use uh, consistently in the chapter. I'd like to know the definition of it.
Sure.
One is agonio. It spells as Agonanai.
Say it again.
Agonal. It's gasping.
Agonal. Agonal.
Agonal. What's that? What does that
So
mean?
agonal means slow, and it usually refers to slow, ineffective breathing. Like sometimes, I think I even mentioned it, sometimes when people go into cardiac arrest.
Right. It says after the cardiac arrest, gasping for agonal respiration.
Right. So you're talking like the minute that somebody goes into cardiac arrest, the brain, the part of the brain that controls breathing, we're going to learn tonight, is called the medulla oblongata that I talked about. It's called your brain stem. So we were made that the medulla holds on to the oxygen the longest, so that when somebody goes into cardiac arrest, the brain still has a tiny little bit of oxygen, so it still tries to breathe, but it's very weak, ineffective breathing, and it's death. The patient's dead. So that you're not supposed to get confused and say, oh, they're still breathing, so I don't need to treat them. So that's what agonal breathing is.
What is spontaneous?
Spontaneous means that it happens on its own. It happens suddenly on its own. So when somebody spontaneously does something, like if you were to get up now and start dancing, it would be that you spontaneously started dancing. No warning, it just happened.
And another word is Nouns. N-O-U-N-S.
Nausea, I guess.
N-A-U, nausea. So nausea was somebody feels like their
No,
stomach.
not nausea, no.
Okay. Say it again.
It's Nouns. Let me just look it up in a second in the...
You got to be, you have it a little wrong. Nouns? N-O-U-N-S?
Right, Nouns, yes, no, yes.
So that's more of a like learning English type of thing. So a noun is a person, place, or thing. So nouns, it's an example, like in other words, let's say, your father is a noun. Washington, D.C. is a noun. So something that's a person, place, or thing is a noun, and something that expresses action is a verb. But that's not something that we're gonna have on a test. I guess they're just trying to teach you the terminology, the difference between nouns and verbs.
It says, for an example, I have it up in the booklet, some suffix combined with roots to form objectives,
right?
Words that modify nouns.
Right, nouns. Okay, so what it's basically saying is suffix and prefixes. So like we had bradycardia, right? B-R-A, let me see if I could, I guess I could type here. I don't know if everybody could see the chats, but we had the word bradycardia, right? So I'm going to put it here, bradycardia. So cardia is the heart. So that would be a noun, right? Because a noun is a person, place, or thing. And the word Brady in front of it means slow. So it means slow heart rate less than 60. But I wouldn't worry about nouns and verbs. They're never going to ask you anything about that. Like what's a noun, what's a verb on a...
They're not going to ask me, but I'm reading in the book. I just want to know the definition.
No, it's fine. Absolutely. I mean, I'm glad you're asking these questions. So, okay.
Thank you.
You're welcome. So, anybody have any other questions? Because it looks like we're getting close to we're up to 30. So I think we're supposed to have 32. Any other questions? So I was working on a quiz to send out. I'll either send it out tonight or tomorrow morning that you could do between now and the next time we have class. Some of you still have not finished the first quiz, so please, finish it up. And you should be able to take it twice, the quiz. So if you don't like your first score and you want to take it again, that's fine. Again, it's not a pass-fail type of thing. It's more or less just to see how much you know and, to prompt you to ask questions and try to figure out, something that you can't figure out on your own. So. And also just you to get into the habit of getting into the habit of taking tests, right? Because for a lot of you, you're not routinely taking tests. So if anybody didn't get the link to the first quiz because you joined a little later, just tomorrow remind me, send me a text tomorrow and with your email address and I'll send it to you. I posted the video from last night up on YouTube, so it looks like about 10 or 15 people looked at it already. So it's up there if you wanted anything that you wanted to review, and obviously I'll do the same thing with this one tonight, okay? So any questions, anything that anybody wants to discuss before we start the actual anatomy and physiology lecture? Okay. So I said before that anatomy and physiology is kind of the basics of learning medicine. So anatomy is the structure or shape of the body, okay? And physiology is how the body works, how the organs work. So this is going to take us multiple nights to go through, okay? And, you know, we'll go nice and slow and we'll keep on reviewing and asking questions and making sure everybody feels comfortable with it. Okay, so, you know, when you're looking at the anatomy part of the body, you have to visualize a body, right? You have to visualize I guess one, you know, one shape of a body. So that was that anatomical position I was talking about. Topography is the like reading of maps. So like the body, you're thinking of like when you're looking at the body, you're looking at it as a map. So this is the what they call the anatomic position. So that whenever you're kind of doing anything with anatomy, you know, you should always picture a patient being in this position, which is standing upright, okay, with the palms facing forward. So anytime they ask you a question and say, you know, what's distal, what's medial, what's this, just close your eyes for a second and picture that this is the position that the patient is in, okay? So we talked about some anatomical terms, right? So the right is always the patient's right, the left is always the patient's left. And we said that there's an imaginary line that's drawn through the center of the body, right? So it would basically go right through the belly button. And those of you that remember, I said that the belly button has a medical term, so I'm going to write it in the chat.
Umbilical something?
Umbilicus, right?
Umbilicus.
So when you learn, or you probably heard it when you had a baby, the umbilical cord, right, that connects the baby to the mother's blood supply, right, connects that hole that it connects into is your umbilicus. That's what's left after the umbilical cord falls off, okay? The other term I'll just put up here, just so I know I did it at least once so far, because this is something. Epistaxis is the medical term for a nosebleed. So, you know, on the state exam, they're going to describe to you, you know, a patient, and you know, they're going to say they have a, you know, they're suffering from an epistaxis. So I always like to start saying it early because it's a hard word to say, and you know, it's a nosebleed. It's just instead of saying the simple way of saying it, it's a nosebleed. So I'll just put those two things up there. Okay, so we said it's always the patient's right and left, that there's an imaginary line, midline. Anything that goes towards the midline is called medial, and anything that goes away from the midline is called lateral. So let me tell you how they would say. They would say a patient has an injury, okay, to the lateral side of their arm. So the lateral side of their arm would be this side, right? And the medial side would be this side. I'm assuming everybody could see the mouse moving. If you can't see the mouse moving, let me know, right? If they said to you, the patient had an injury on the lateral side of their thorax. So their thorax is their chest. The lateral side would be here. If they said the medial side, it would be here, okay? Distal and proximal, these two words here. Distal, think of distance, okay? So distal means it's further away from the center of the body, and proximal means it's closer to the body. Now, most of the times we use this when we're talking about pulse sites. A pulse is an area where an artery runs over a bone, so that if you were to put your fingers and press on the artery and trap it against the bone, you would feel a pulse. So they would always say the patient has a distal pulse, or the patient doesn't have a distal pulse, or the patient's proximal pulse is closer, is stronger than their distal pulse. So if you think about it, your heart's right here, right? So when your heart pumps, the pulse sites closest to the heart are always going to be stronger than the pulse sites further away. So proximal pulses are always going to be stronger than distal pulses, okay? And then if you go the other way, if somebody's running into a problem where they're losing blood, you'd be more likely to lose your distal pulse first because it was the weaker pulse to start and because it's further away from the heart. So that's kind of how they use that. Okay, and again, they're showing you distal being further away, proximal. And then let me see if I have another picture coming up to show you. No. So the other thing that we had was at the front of the body was called anterior. Yes?
Yesterday you say the words up and down, the other words, not distal and
No,
proximal.
so distal and proximal, not up and down. Okay? Distal and proximal are further away from the body and closer to the body. So in other words, if I'm saying the pulse in your wrist is a distal pulse and the pulse in the inside of your arm over here is a proximal pulse, what you're thinking is superior, means going towards the ceiling, and inferior is going towards the floor, and then
That's correct. Thanks.
and then anterior is the front of the body and posterior is the back of the body. Okay, so this is what I'm going over because this is confusing to people, you know, where it's making it look like the arrow's making it look like proximal is going towards the head and down here it's going upwards. It's not really a good way. All they're trying to say to you is when you use the term proximal, it's closer to the center of the body in comparison to something else. Okay, when you say distal, it's further away from the center of the body. So again, the pulse in the wrist is distal in comparison to the pulse in your upper arm, because the pulse in your upper arm is closer to the center of your body. So we would call it proximal. Okay, so that's really it. So again, going towards the ceiling is superior, going to the floor is inferior, going to the back is posterior, and going to the front is anterior. And don't make yourself crazy. You're going to get it. I'll keep on saying it, and you just got to do some reading and look at the pictures and stuff like that. Okay, now positions of the body, right? So this is not yet how the body works. We're just talking about just some general stuff, a little review of what we did yesterday. Okay, so supine is a patient who's on their spine, right? So your spine is your backbone. So supine means the patient's laying flat on their back, okay? So this is the only position that we could use to assess a patient. So if a patient's prone, which is face down, okay, we can't really assess them because we can't see what's going on. So if they were in this position, which is prone, we wouldn't be able to see what's going on. So if we find a patient prone, we always have to move them into supine position, okay? Okay, then we said putting the patients on their side. So this guy is laying on his right side, okay? And so he's right lateral because the side is lateral, right? We just already said the side is lateral and towards the middle is medial. So he's in a right lateral recumbent position, okay? Or if he was on his left side, it would be a left lateral recumbent position. And again, when somebody has a...
When are you using recumbent and recovery? Is there a difference in the two?
No, there's not. Recovery position is the general term for putting somebody on their side. And this is just a more specific way of describing it. Like if you were like in the hospital and they were documenting a position a patient was most comfortable in, they wouldn't say, if the patient was comfortable on their side, they wouldn't say recovery position. They would say they were in a recumbent position. So recovery position is more of something we put the patient in because they're unconscious and we're worried that if they were to throw up, if they were to vomit, that they could aspirate that vomitus into their lungs. Remember, the only thing that's supposed to be in your lungs is air. So it's a huge problem if somebody has anything else in their airway or their lungs other than air. And that situation, when somebody has something other than air in their lungs, is called aspiration. Okay. So now, this is really what we call the semi-Fowler's. So you put the word SEMI, semi-Fowler's position. This is the typical position that we transport a patient on the stretcher, maybe a little lower, okay? True Fowler's would mean they were going straight up like an L. So that's a very uncomfortable position for somebody to be in. Like if you were sitting in a firm chair, in an upright position, that would kind of be like the Fowler's position. So the most common position that we transport patients in is the semi-Fowler's position. Okay, and nowadays the straps on the ambulance have to have two straps that come from up here over each patient's shoulder and connect to this one. So you still have this one, and this one, but you actually have to have what they call the shoulder straps that come over a patient, over their right and left shoulder, and connect into this top strap, okay, to stop them from flying out, if God forbid there was a bad accident or anything like that. Okay, Trendelenburg and shock position, right? So this is basically a position they used to put patients in if their blood pressure was low to kind of get blood to flow to their head, but they found that it made it very, very difficult for them to breathe. So we never actually take a patient and like lower their head, that when they make their head lower than their legs. So this is kind of somewhere in between. You know, the head is a little lower. It's acceptable to just raise the legs a little bit, okay? But you don't want to put them in a position where they're completely lowered down, because what happens is your stomach shifts up on your diaphragm, and your diaphragm is this bell-shaped muscle that goes between your stomach and your chest that makes you breathe. And if your stomach presses on your diaphragm, it becomes very difficult for you to breathe. It's kind of like, you know, after you have your, you know, Shabbos day Suda, and if you ate too much, you feel like it's hard for you to take a deep breath because your stomach is so full of food. It's pressing up on your diaphragm. It doesn't allow your lungs to expand to the right, you know, the right amount. So it's the same thing. So the Trendelenburg position is no longer recommended, you know, for a patient who's in shock. Shock means that their blood pressure is not adequate for what they need, okay? And the reason is that it makes it more difficult for them to breathe. And the other thing is it raises some could raise the blood pressure in their head, and intracranial means in their head, too high, okay? And then the Trendelenburg and the shock position are absolutely contraindicated. So contraindicated, indicated means that you would do it. Contraindicated means you wouldn't do it in patients where you suspect they have an injury to their spine. So we're going to talk in a second what your spinal cord is, but your spinal cord is a large nerve that connects your brain to the rest of your body. So you've heard people having a spinal injury and they're paralyzed and they can't move and everything like that. So that's the reason why we wouldn't want to manipulate their spine when they're in that position. So somebody who has a spinal cord injury, we just keep flat. Okay, now dividing the abdomen, okay, into four, what they call quadrants. Quadrants mean 4 parts. Quad means 4 in Latin. So quadrants is 4 parts, okay? So we draw an imaginary line. So you have the midline that's going through the belly button, and then you draw another line laterally, horizontally, right, through the midline. And now you divide the abdomen into 4 quadrants. Just for a point of reference, your pants would probably be about here. Your belt would probably be about here, okay? Unless you really wear your pants high, okay? So we divide it into 4 quadrants, and they're basically going to ask you, what do you find, okay, in each quadrant? Now, the interesting thing is, well, the first thing that's interesting is that they really don't have much of the liver. Oh, here it is, I'm sorry. So the way it works is that some organs go on both sides. So this big brown thing here is your liver, okay? Because the vast majority of the liver is on the right side, it's considered a right-sided organ, even though some of it goes on the left side, okay? So on the right side, they're mainly going to say it's your liver and your gallbladder, okay? On your left side, they're going to talk about an organ that they don't have here to see, which is the spleen. So when we talk about trauma, we're going to talk about the spleen a lot because it's a small organ, but it bleeds a lot in trauma, okay? And the other one they're going to talk about is your stomach, which is this organ right in here, okay? Those are kind of the left-sided organs, okay? And your pancreas, which is an organ that plays a role in, you know, controlling your insulin and in diabetes and stuff like that. In the right lower quadrant, they're mainly going to talk about the appendix. So you've all heard of people having appendicitis, okay? Now, left one is going to be mainly made up of your colon and in a female, some of the reproductive organs, and the same reproductive organs that a female has on the left side, she has on her right side. There's doubles of them. Now, there's one set of organs that move through all the quadrants of your body, right? And that's your intestine. And when we talk about abdominal stuff, you have a large intestine and you have a small intestine, but they actually, both the large and small intestine are found in all 4 quadrants of your body, okay? So again, it's a lot for tonight, but at some point you'll know that the liver is on the right side and the spleen's on the left side and the appendix is on the lower right side. These are just things that we'll constantly be reviewing, okay? Okay, so now we're going to talk about the body's made up of organs, and organs that do the same thing are called systems. So we're going to talk about now the different systems of the body that all are supposed to work together to keep you alive, right? So the human body is an amazing structure. And, despite what we do sometimes not to make it work properly, it has a lot of backup mechanisms to, keep it doing what it needs to do. Okay, so the first system we're going to talk about is the system that allows you to move, okay, and the system that makes us have shape. And that's your muscles and your skeleton. Okay, so muscular, skeletal are the muscles of the body and the skeleton of the body. Okay, so obviously the skeleton is the bones that give us shape, right? If we didn't have bones and muscles, we would have no shape, we would have no form. We'd just be like a blob of stuff on the floor. Okay, so you have the bones, you have ligaments, tendons, muscles. Okay, so ligaments and tendons. So ligaments hold joints together. So a joint is where two bones meet. So like, look at your elbow, right? So your elbow is a joint, and you have the bones of your humerus, which is your upper arm, and your radius and ulnar bone, which are two bones in your lower arm, and they meet and join together, okay, at your elbow. And there are ligaments, which are like bands of rope, very, very tough bands of rope that hold it in place so it doesn't slip out of place. Okay, tendons are the connection between muscles and bones. So if you look, you have your bicep muscle right over here. Okay, your bicep muscle attaches via ligament to the top of your humerus and to the bottom of your humerus. Your humerus is the bone of your upper arm. Okay, so why muscles don't attach directly to bone, I don't know that, but that's how we're made. There's a muscle, and that what actually attaches to the bone is a tendon. Okay, and don't worry about the other, but they're talking like there's cartilage and there's other things. We'll talk about that more as we get on. Okay, so they're going to ask you in a test, what is the function of the what is the function of the musculoskeletal system? Okay, so it has really four main functions. I don't know why it says three here. One is that it gives the body shape. It protects the organs inside of the body, right? So your muscles and your bones protect your organs on the inside of the body. It provides for movement. So how do we move? Well, the muscles contract. Okay, well, you do, first of all, moving is a voluntary thing. In other words, you decide to move. So it's a voluntary. There's things in our body that are involuntary, like breathing. We don't have to decide to breathe. We could modify our breathing, right? We could hold our breath or we could breathe faster, but the actual deciding of breathing is what they call an involuntary function. And that's because obviously we have to sleep and we have to breathe. So while we're sleeping, it becomes an involuntary function that the body makes us breathe without us even thinking about it. But movement is what we call a voluntary function, so that we have to, decide to be able to move. And then we will it, we think it in our brain, and our brain tells the right muscles to start getting tighter, contracting, and they pull on bones and they make joints bend and you move. So that's what, basically movement is. Okay, and then the bones store minerals, calcium and different minerals in them that we need, the body needs. Okay, so minerals are good things. Okay, and it produces the red blood cells that carry oxygen. So that's another thing that bones do. Bones aren't, everybody thinks bones are just this hard, kind of like a branch of a tree type of thing. But bones actually, most bones are hollow on the inside, and they actually produce blood vessels. And running throughout a bone is a whole series of blood vessels, because just like the skin needs blood to give it oxygen and sugar, the bones need blood to keep it alive, right? The blood always contains the things we need to keep the body alive. So the bones are a living thing. Yes, they're hard, okay, as compared to skin, but they're a living thing. They're not, like a dead piece of wood or anything like that. So I'm trying to read what somebody texted here. A possible answer why God created us. So if a bone breaks, the muscle would not automatically with it, maybe. Okay, well, you could explain to me. I'm not exactly sure what you're saying, but you could explain it to me. It actually, I always kind of teased that, when I was in Israel the first time, I went to Or Sameach, and they had this whole program of trying to convince these Jewish kids who are not religious that there's a God. And these were kids that all had high school and college educations and secular life and stuff like that. And I remember saying to the rabbi, I said, all you have to do is explain to them and talk to them about the body. And I don't think that anybody could say that all this stuff in the body happened accidentally, that the whole, the way the body works is just an accident, that it wasn't a planned thing. Anyway, let me just shut something off on my computer. Okay. So now your skeleton is the term for all the bones of your body. So I don't want to freak you out with all these different bones that you're looking at and stuff here. But at some point, the vast majority of these bones you're going to know the names of, okay? So let's just talk about them simply. Your skull, okay, is called your cranium, okay? And there's parts to it you're going to see in a second. Your jaw, okay, has two parts to it. And the part that moves is always going to be a test question. The mandible, which is the lower part of the jaw that moves, okay, is what your tongue is attached to. So when we talk about airway problems, one of the problems people have when they're unconscious is that their tongue relaxes and partially blocks their airway. And you've all seen this, heard this, it probably has happened to you, that when you're sleeping, you snore, okay? So the sound of snoring is the sound that the tongue makes when it partially blocks the airway. And the way we deal with that is we actually move the mandible, okay? When you learned in CPR skills and you were doing your head tilt chin lift, right? You were moving the mandible up out of the way to get the tongue up out of the way so you could ventilate the patient. Okay, your clavicle is your collarbone, okay? And you can't see it well here, but hopefully there's a next picture, your scapula or your shoulder bones in the back, okay? In your arm, the big bone of your upper arm is your humerus. Then you had your elbow, and then you have two bones. You have a radius bone and an ulnar bone. Your radius is on the thumb side, okay? And your ulna is on the pinky side. Now, if we were going back to our picture of the person in the anatomical position, that would mean the thumb, okay? The radius bone is always on the lateral side because the thumb, when your palms are facing forward, is out, right, facing out to the side. So your radius bone is the lateral bone and your ulnar bone is the medial bone. The other thing you're going to hear is that we always check for a radial pulse. So the radial pulse is the pulse when the radial artery goes over the radius bone and you can press on it. Okay, and again, if I'm saying too much, you know, and you're getting like a little freaked out, don't. We're going to go over it a million times, okay? Your sternum is your breastbone, right in the center of your body. That's where you're doing CPR, okay? Then you have your 12 ribs on each side, okay? You have your pelvis, which is your big, large bone right over here. And there's many different parts to the pelvis, but we don't really worry about them too much. In your lower leg, the largest bone of your body, sounds like a test question, right? The largest bone of your body is your femur, okay? Then you have your knee, and you actually have a little bone in the front of your knee called your patella, but your knee is the joint. The patella is the bone that they call your kneecap. And then you have a tibia and a fibula in your lower leg. So these are not actually side by side like they are up here. The tibia is the front bone and the fibula is the backbone. Now, the way I remembered that when I was in school is that T for tibia is top. Okay, so the tibia is the top bone, is the front bone, and the fibula is the lower bone. The tibia is the bone that you bear weight on when you walk. The fibula actually is not a weight-bearing bone, so if you fracture it, a lot of times you don't even get a cast. You just kind of get a soft splint, they call it, like they wrap it. You need it for balance, right? You can't just walk on your tibia, it would be very painful, but your tibia is actually the weight-bearing bone that keeps you upright. And then, you know, your ankles are called your tarsals, and we'll talk about, you know, we don't really get into all of that stuff in EMT class, okay? So there's just some different bones to make things up, okay? Here's a picture of the skull. So this bone right here was when I said it was called the mandible, right? So that's your lower jaw. And this over here is called your maxilla. That's your upper jaw, okay? And the reason we keep on talking about this again is from an airway standpoint, this is what the tongue is attached to, so that when somebody is snoring, we have to make sure that this lower jaw, this lower bone is moved forward so that the tongue gets up out of the airway, okay? And then this would be where your nose is, okay? You have your skull, the different parts to it. When we talk about trauma, we're going to say the most dangerous place for a patient to get hit on their skull is the side of their skull. The bone is the thinnest here, okay? It's the thickest in the front. It's the thinnest on the side. And running right underneath the bone on the side is a big artery. So when people have a shot, a blow to the side of the head, they could actually rupture that artery and start bleeding inside their skull. Now, the skull is pretty much a closed cavity. So if you start bleeding inside this closed cavity, you start generating a huge amount of pressure and you actually crush the skull. So you've heard people have brain swelling. That's what I'm talking about, right? So when it's not the brain that's swelling, It's that the blood is leaking into this closed cavity of your cranium, of your skull, and it has nowhere to go, so it's kind of crushing the brain. Okay, okay, so again, mandible, lower jaw, maxilla, upper jaw, nasal bones, the orbits of the eye are the bone around the eye, okay, and the zygoma is your cheekbone, right by alongside your nose. So the ones that you're going to know for the test is going to be your mandible. That's the main one they talk about. Okay, so again, different parts of your skull. This is showing you very nicely the mandible, right? And the mandible is a hinged bone, right? It has a joint, so it allows it to open and close. Okay, I just put up here one thing. So like we're going to see when we talk about trauma and we examine the head, there's a little bone right here called the mastoid bone. There's a muscle that comes from here to here, and that's how you move your jaw. Okay, when the muscle contracts, it pulls the jaw open. Okay, but when somebody has a very specific type of fracture to the bottom part of the skull, okay, and blood leaks, they get a very interesting bruise over here, which is something we look for to see if somebody has what they call a basilar or base part of the skull fracture. Okay, your spinal column versus your spinal cord. So your spinal column is the bone that allows you to stand upright. It's basically what you rest on, or you stand on, so to speak. It keeps you upright. The spinal cord is a nerve that runs inside of it, okay? And so your spinal column has two main roles, okay? It's there for shape and movement, but it's also there to protect your spinal cord, okay? So you have 33 vertebrae, and believe it or not, this is a question they ask on the test. So again, you're not a better EMT because you know there's 33 vertebrae, but you need to know it so you pass the test. The other thing they could ask you is how many vertebrae in each section. Okay, so you see here there's 5 sections. So your cervical section, okay, is your neck. Your thoracic section is your thorax, is your chest. Your lumbar is your lower back. This is where mainly when people have back problems, this is mainly where they have it because they're the biggest vertebrae, but they are supporting the entire weight of the body. So when people are overweight, what happens is they wear out in between each one of these vertebrae or a little disc of cartilage that acts like a shock absorber. And when people are overweight for a long period of time, they wear out that disc, and now you have bone on bone rubbing. And at each level, at each 33 of these vertebrae, these little bones that make up your spine, at each level, there's a nerves coming out from the sides. So if you wear out the disc between them, the bones now press on the nerves, and it's excruciatingly painful for people. And that's when people say like they have lower back pain and stuff like that. If it's an actual structural problem, like with the bones, sometimes people have lower back pain because they pulled the muscle. That's completely different, right? But we're saying when people have chronic pain, very, very bad pain. Okay, so cervical, neck, thoracic, chest, lumbar, lower back, and then we have a fused section of 2 pieces of bone. Your sacral bone or sacrum, and you have your coccyx, which is this little kind of almost looks like a tail over here. Okay, so this is the sacrum, and then the coccyx kind of hangs down. You see it better from the side than you do from front and back. Okay, your spinal cord does not go all the way down to here. This is your spinal column, which is the bones. Your spinal cord is running inside of it, and it comes down into about to the lumbar area. Okay. So again, the reason we have this column is to give us shape, allow us to stand upright and move, okay, and to protect our spinal cord, which is our connection between our brain and the rest of our body. Okay, so again, just showing you this. Okay, we'll go, let's see, what time is it? 8:36. We'll go to 8:45 and we'll take a break because I know this is a lot of stuff to digest. Okay, now your chest is called your thorax. And sometimes they'll say thoracic cavity, right? A cavity is not like a cavity in a teeth. A cavity is like a section of the body, okay? So your thorax or your thoracic cavity is the medical way of talking about your chest. And your chest basically goes from your shoulders, okay, to that muscle of the diaphragm that I said is your division between your thorax and your abdomen, okay? Okay, so inside your chest, with the exception of your skull, is pretty much the rest of your vital organs, right? Your skull has your brain, which is a very important organ, and then your chest has most of your other vital organs. which are your lungs, your heart, and all the major blood vessels of the body that we're going to talk about in a second. Okay. So the bones of the thorax, which are your ribs and your sternum, your clavicles, right to the top here, and your scapula, your shoulder bones to the back, all protect those vital organs. And then you have big muscle groups, right? Your pectoral muscles and stuff like that to protect your organs inside your chest. Okay. Okay. So again, showing you a different view. I'll go through it from pretty much the top. Your trachea is your connection from your mouth to your lungs. We call it, some people call it the windpipe, okay, but the medical term for it is your trachea. And behind the trachea is your food pipe or your esophagus. So that right up here, there's a structure, and we'll see it when we do the airway, okay, called your larynx. And inside your larynx, there's a structure called your epiglottis. And what happens is that when you swallow water, food, or whatever, your epiglottis closes off the opening to your airway so that the food goes to the back to the food pipe. So that's what prevents food from entering your lungs, okay? So it comes now, so it comes in your trachea. Your thymus is just a gland, don't worry about it right now, okay? So your trachea comes down, okay? It's a little, just probably about your nipples, maybe a little higher than your nipples, and it splits into two other tubes. So your trachea is just a tube that air travels through. It comes down and splits into two other tubes, which obviously one goes to your right lung and one goes to your left lung. So this is what's called your airway, because it's what brings air into your lungs, okay? Then you have your lungs, okay? Your lungs are divided into sections or lobes. Your right lung has 3 lobes. Your left lung only has 2 lobes because it has a little notch carved out of it that the heart fits into, okay? Your heart sits in the center of your chest, okay? With a little bit moving over to the left side of your chest, okay? So the size of the lungs are pretty equal. Even though one has 3 lobes and one has 2 lobes, the actual size or total capacity are pretty much the same. And then running underneath here, okay, would be your diaphragm, your muscle of breathing. Okay. Bones of your pelvis, don't worry about, okay, but the one thing I will mention is that you've all heard of, you know, grandfather, grandmother, uncle, aunt who has a hip fracture. So there is no true hip bone, right? Hip, H-I-P. There's no hip bone. The hip is the joint where the femur bone comes into the pelvis bone, okay? So this little section right in here where these two things meet is called your hip, okay? Now, what's interesting about the femur bone, let me see if I have a better picture of it. Okay. Let me go back here for a second. So this bone, basically from your knee all the way up to your hip, is your femur. So your femur comes up like a straight bone, and then it has this angle and this turn. And right where the femur meets the hip, there's a ball. There's actually what looks like a little round ball, and it fits into a groove that's actually carved out into the hip, into the pelvis, so that your femur bone fits right in here, and it's held in place by what we call ligaments, okay, that hold it in place. So this is all part of your femur, right? This bone is going way down all the way, you know, to your knee now. But this section right here, which is the neck of your femur, or your femoral neck that they say here, this is the part when most people have hip fractures. This is the part that actually breaks, okay? Because just picture the enormous weight of the body is kind of resting on all this, right? Your whole upper body is resting right on this section right here. And as people get older and the bones start to deteriorate, this is where they have a hip fracture, okay? And again, this fits right into this little groove right over here, and that's what happens. This is showing you the spinal cord, the spinal column, right? It would be going all the way up to your head, right? Because it goes from your neck all the way down. This is showing you the portion of the spinal column where we said it fuses together, okay? So this is your lower spinal column, and this is your sacral and coccyx bone, okay, where it fuses all together, and it would look like a little tail at the bottom there, okay? And these bones over here in a woman, these are their pelvic bones that have to relax to able to allow the baby to come out, okay? So this is, you know, when they say a woman has to be, you know, dilated enough and relaxed enough, so these bones actually soften with pregnancy because of certain hormones that are secreted by the woman when she's pregnant, and they relax enough to let the baby actually travel out of the woman's body. Okay, so lower leg, we said the femur, and here you see the neck of the femur and the ball of the femur comes down, okay, and it meets two other bones, the tibia and the fibula, in a joint called your knee, and there is a little disc of bone, a little round shield of bone over it called your patella or kneecap, and then it goes down into the bones that make up your foot. The first bone will be your ankle, and then it goes down into your feet. So again, the femur is the big bone of the upper leg. On the test, they're going to say, what's the largest bone of the body? And that's your femur, okay? Patella is your kneecap. So, and then you have, is that me doing that, or is that someone else doing it? I'm just going to mute everybody for a second, see if that helps. Okay, so everybody's muted. If you have a question, just unmute yourself. Okay, your tibia and your fibula are two bones of your lower leg. Remember, the tibia is the top bone, T for top. Fibula is behind it, and it comes down into your ankle and your feet and your toes. Okay, so we'll do 2 more minutes and then we'll stop. They're not going to ask you the bones that make up your foot, but if you see, you know, this is why the foot has a doctor all to itself, right? Like a podiatrist. The foot is made up of so many different bones. It's such an interesting structure. Like when we look at it, it looks like it's one just large bone, but it's made up of tons of different bones. This is your heel bone, right? You have your ankle bone right in here. This is your tibia and fibula coming down. So this is the joint of your ankle, right? And all the way down to your toes. So it's a very interesting, and anybody who suffers with problems with their feet, now you can kind of see why it's such a complicated structure. Okay, and then your upper extremities, we said the big bone of the upper extremities is your humerus, and your humerus comes into a joint made up of, called your shoulder, that's made up of 3 bones. So your shoulder is made up of your humerus, your clavicle, which is a collarbone to the front, okay, and your scapula, which is your shoulder bone to the back. So you have a clavicle, collarbone, scapula, shoulder bone, then you have your shoulder joint, which is made up of the humerus, which is the big bone of your upper arm, your clavicle, and your scapula. Okay. And then in the lower arm, below the elbow joint, you had 2 bones, the radius and the ulna. We said that the radius bone is on the lateral side, so it's, you know, on the outside of the body. The ulnar bone is on the inside of the body. Now, obviously, it depends how you hold your arm, but if you again have to picture the anatomical position with the person standing upright with their thumbs facing out to the side, since the radius bone is on the thumb side, it's going to be on the lateral side, and then the ulnar bone would be on the medial side, which means it would be closer to the patient. And then you have your wrist and hands and fingers, just like you had down into the foot. Okay, so we don't have to worry about those. So we said joints are basically where bones meet bones, and they're held in place with ligaments. Okay, so ligaments are ropes that hold the joints together. So when somebody has a dislocation, it's an injury where the joint has been spread apart. So the ligaments have been weakened or torn, and the joint has been kind of torn apart. There's no way really to know without an X-ray or a CAT scan, because it's just as painful as somebody who breaks a bone, which we call a fracture. Okay, so that was the skeletal system. And just a quick review, okay, we said musculoskeletal wise, the whole concept of muscles and skeletons together is for, we said, a couple different reasons. It's to give the body shape, it's to protect the organs, and it's to allow for movement. And that movement was called locomotion, like the locomotive in the front of a train that pulls a train. Okay, and then also we said some minerals and blood cells are made there. So now we're going to take a break. So I see some of you are holding your heads. Some of you look tired. Some of you looked, you know, overwhelmed. Some of you are waving. Some of you are still driving. Listen, this is the hardest part of the class, right? I mean, unless you had some interest in this or some background in this, this is all new stuff, all like foreign, you know, foreign language. We're going to go through it tons and tons of times until everybody understands it. Okay, so everybody's going to take, it's 8:46, we're going to come back at 9 o'clock. Everybody take a couple of minutes, stretch your legs, get a drink, use the bathroom. I'll come back early, and if anybody has any questions, you know, you can ask them, okay? So go take a break. I'm just going to pause the recording. Okay, for those of you who are still around, does anybody have any questions on anything they'd like to review?
I'm just passing the J70 the throughway,
Mm-hmm.
and an MVA happened with 2 motorcycles.
Uh-oh.
One motorcycle flipped over the gate.
The guardrail?
Yeah,
Where on the thruway?
before the throughway from J70,
Oh.
by the ramp.
Because I was going to say I didn't get a text.
Yeah.
Nope.
It's too much bones to be having mind in one class.
No, I know. It's hard. We're going to go over it time and time again, but we got to go, we got to start at some point and we'll never get done. So. Here, I'll show you something. Let's see. Let me see if I can find a question. Okay. Okay, so here's an example. Can you see these test questions that are up on the screen? So here's an example of,
Can you zoom in a little bit?
yeah, hold on.
On the bottom right, there's a plus. You could zoom in.
On the bottom, oh, too much. Okay, so here's a test question on the exam. It says anatomically, the term superior in relation to other body structures is defined as. So I'm not going to answer it. Nobody call out yet. Just read it. So it says anatomically, the term superior. So we had superior and we had inferior. Okay, in relation to other body structures is defined as.
Towards the head.
Very good. Okay. So you already got one question out of your 100 questions on your exam right. Okay.
You said 100?
I'm sorry?
You said 100 questions?
No, I said on your state exam. Your state exam's 100 questions.
No, that's what I was. Oh my God. Okay.
Okay. So here's one that we went over briefly. Okay. It says the tube-like anatomic structure that carries air from the throat to the lungs is the. Okay. So again, we only said it once, but I'll go through it. Your pharynx is the medical term for your throat. Your larynx is where I said it's the top of your windpipe. And the actual tube is called your trachea. That was your windpipe. So that's the right answer. And your esophagus was your food pipe. And I said your trachea is more to the front of your body, so it's more anterior. And your esophagus is behind it, so it's more posterior. Okay. Let's see if there's any others that we might know. Okay, here, this one you probably know. Okay, the upper 2 chambers of the heart are known as. So again, don't answer right away. Okay, so the upper, so we said the heart had 4 chambers. There's 2 upper chambers, 2 lower chambers, right? And that, you know, obviously the upper chambers are divided between the right side and the left side, and the lower chambers are divided between the right side and the left side. So does anybody remember what the upper chambers are called?
Ventricles.
What upper chambers are atria.
Yeah.
Or atriums. The lower chambers are ventricles. Okay, your aorta is the largest artery of your body that comes off your left ventricle and goes to your whole, you know, pumps blood to your whole body. And arteriole is a term for a small artery. So you see how I'm just showing you how they ask questions on the exam. Okay. Which one of the following arteries is found in the neck? So again, we talked about this briefly when we did CPR, but we said when we check for a pulse in somebody who's in cardiac arrest, we check in the neck. And the artery is called the carotid artery in the neck. The jugular is a vein in the neck. The temporal is an artery in your temple, the side of your head here that you feel pounding sometimes when you have a headache, right, on the side over here. And your subclavian is the artery right under your collarbone and the top of your chest here. Okay. So just giving you an idea of like the kinds of questions you'll see. I think I ran out of questions. Okay, well, we'll go over more. We'll be constantly going over questions. Okay, so we got 1 minute.
Also send all the questions in the Dropbox link.
Oh, so people are now stuck in this accident.
Yeah, let's start burning.
Okay. Okay. So let's pick up where we left off. Okay. So we said that we had the musculoskeletal system. We talked about the reasons why we have one, right, is to give a shape, allow us to move, and so on. Now we talked about the skeletal part of it, the bones. Now we're going to talk about the muscular part of it. Okay, let's see, somebody's chatting. I don't know what they're talking about. Okay. Okay, so now the way a muscle works is that there's 3 types of muscles. Okay, there's skeletal muscle, which are the muscles that allow you to move. There's smooth muscles, which are found in your stomach, okay, or found in your lungs, found in your digestive tract where food moves through, okay, and then there's cardiac muscle that's found in your heart. And then we further subdivided that skeletal muscle are voluntary. So what does voluntary mean? It means to move around, to move your muscles of your bones, right, that move bones. You have to wish it to happen. You have to think it to happen. So it's voluntary. You have control over it. Where the muscles of the smooth muscles, which are found in your blood vessels, your lungs, and your stomach, okay, and also like your bladder to allow you to urinate and stuff like that, those basically don't really require you to do much. In other words, you don't have to tell the muscles of your lungs to breathe. You don't have to tell your blood vessels to do things. They all kind of happen with your brain controlling it. So those are called involuntary, where you don't really have much control. Sometimes you can modify it a little bit, okay, but you don't have a lot of control over it. And then the last type of muscle, which is very specialized, which is the heart muscle, the cardiac muscle. And what's interesting about the cardiac muscle we talked about is that we said, you know, in some previous classes that the brain doesn't really control the heart beating. The heart has its own control system inside that we call a pacemaker, okay? So the heart muscle is the only muscle that can take care of itself without the brain getting involved.
My apologies.
Because the other two, the skeletal, we think it to happen, and smooth, the brain just takes care of it on its own. So the only one where the brain has no real super involvement is the heart, okay? Hold on 1 second. So now, again, just a busy slide showing a lot of different muscles. We'll talk about that as we go on. This is just showing you, if you were to look at the muscles, what they would look like, the different types of muscles. But again, we don't have to worry about that on the EMT level. Okay, just reviewing again that voluntary muscles mean we tell it to do something, we tell it to move, and those are found in the skeleton of the body. They connect, muscles going to connect to bones, that when they pull, the bones move and we walk and or grab things or do something. Okay, involuntary muscles are smooth muscles. Skeletal muscles are kind of rough. These are smooth muscles. They're involuntary muscles, and we find them in our airway, in our blood vessels, in our digestive tract to move food, okay? And we don't control them. The brain controls them. We can, you know, like let's say, I don't know, you feel like you're gonna, you're driving 2 hours, you feel like you have to go to the bathroom, but there's no bathroom. So you can stop yourself from going to the bathroom up to a certain point. So you can exert some control over it, even though it's a smooth muscle, an involuntary muscle. But if you were sleeping, it would work on its own. That's why we don't typically go to the bathroom while we're sleeping, because our brain knows that we're sleeping and knows that we shouldn't be going to the bathroom. Okay, and then cardiac muscle is the muscle that has the ability to automatically control itself. So that's called automaticity. So the heart is the only muscle that has the ability to generate and conduct its own impulses. So a muscle moves by electrical impulses. We actually have electricity traveling through our body through nerves, and that's what tells our muscles to do what they're going to do. Okay, so again, skeletal muscle is voluntary. It allows for us to move. Okay, we tell it to do it, right? We want to go somewhere. Our brain tells those muscles to move. Okay, again, cardiac muscle, we said, has its own pacemaker site, its ability to initiate its own impulses, and smooth muscles, okay, are involuntary. Everything's performed automatically, and they're found in blood vessels, the respiratory system, the digestive tract, and your urinary and reproductive tracts. Okay, so now we're going to start talking about the real, anatomy and physiology of the body. Okay, so the respiratory system. Okay, so we talked about the musculoskeletal. Now we're going to go to another system. The respiratory system is a system of breathing, right? Respiration is that you move gases around to do things. So the two main gases we talk about in the respiratory system are oxygen, which is the fuel of the body along with sugar, and carbon dioxide, which is the waste product after we burn up that oxygen and make energy. Okay, so the respiratory system brings oxygen in from the room air. Room air has about 21% oxygen. When we give somebody oxygen from an oxygen tank, that has 100% oxygen. Okay, and we use about 5% of that. So if 21% coming in, we use about 5% of it roughly, So what's that bring us down to? Like 16% that we're exhaling. Okay, so the air that we're exhaling still has 16% oxygen in, which is why if you ever, God forbid, had to do mouth-to-mouth breathing on someone, which you really shouldn't be doing, but let's say it's a relative, okay, you're still breathing enough oxygen into them because your air coming out of your body has 16% oxygen, and we only use about 5% of the oxygen that we breathe in, okay? So again, we bring oxygen in from the outside, okay? Carbon dioxide we remove from the body, okay? And then just some terms. So respiration is actually those gases exchanging at a structure in our body called the alveoli, and we'll talk about that in a second. Ventilation, which sometimes people use these two terms interchangeably, ventilation is just a moving of air in and out of your respiratory system. Okay, so now why do we say that? You could be moving air in and out of your lungs perfectly, but you could still be having a problem because not only does the air have to move in and out of your system perfectly, it has to now diffuse or exchange at the level of these alveoli into the bloodstream. So let's say there's a problem, that maybe you don't have enough red blood cells. So red blood cells carry oxygen. So you're breathing perfectly, your ventilation is working okay, but you don't have enough red blood cells to pick up that oxygen and transport it to the body. So the ventilation part is working fine, but the gas exchange, the respiration part is not working fine. So we'll talk about that more, as we go on, it'll make more sense. So we have a system of acids and bases. If anybody ever was a lifeguard and you maintained a pool, one of the things you had to do every morning or probably multiple times during the day is you had to measure the water for its acid-base balance. And sometimes you had to add different chemicals in to adjust it. So our body's the same way, okay, that we have a certain balance between acids and bases. These are just chemicals or like degrees of chemicals in our body, okay? But the difference is that the brain and the body itself maintains that level for us unless we have a real life-threatening emergency, okay? So one of the ways that we maintain our acid-base balance is through our respiratory system. And if we see ourselves getting too acidic, too much towards one side, think of it as like a scale going back and forth. So if we start getting too towards the low side, the acidic side, okay, the body will help to correct it by removing more carbon dioxide from the body. So how do you think the body corrects it by moving more carbon dioxide? What does it have to do to get rid of more carbon dioxide? If the way it gets rid of it is by exhaling, what does it make you do? It makes you breathe more often, and it makes you actually breathe deeper so that you get rid of more carbon dioxide. And by doing that, you lower that acid-base balance and you correct it. So, I mean, I can't picture how I could explain it to you like in something that's probably gone on your body right now, because, you know, unless you had a life-threatening emergency, you probably never would have that. But, you know, just to kind of get the concept that all your body systems work in unison, work together to keep everything in a steady state so that everything's at the perfect numbers that it should be. Okay, now the structures of the respiratory system. So you have your mouth and your nose, okay, that you start to breathe through. Now, what do you think is the better way to breathe, through your mouth or through your nose? Anybody have any idea?
Well, it's definitely easier through the mouth.
It is easier because it's larger. It's actually not larger. I'll show you in a second. It's interesting. It's interesting.
The right way is usually through the nose.
You're right. Now,
And you're breathing out through the mouth.
okay, so why? So now you're right, but now explain to me, why is it better to breathe through your nose? Because God gave us certain things in our nose.
Filtered.
Very good. So one of the things it does is it filters. So how does it filter? You have hair in your nose and you have mucus in your nose, right? So mucus is that sticky stuff, okay? And when dust starts to enter your airway, it gets stuck in the mucus in the hair and doesn't hopefully enter any further. Now, the mucus lines your entire airway all the way down to your lungs, okay? But, you know, where we see most of it is in our nose. Okay, now, so the nose does a couple other things, okay? So the first thing is, and I'll show you a picture in a second, is that your nose is not smooth on the inside. It's actually rough. The bones of the inside of your nose are actually look like steps, going up steps. And the reason why is the air comes in and it hits those steps, it actually starts to spin around. And those steps are called turbinates. On the plane, when there's turbulence, the plane is jumping all over the place. So what the turbinates do is they make the air spin around so that all the pollutants, all the bad stuff can get caught in the mucus. Okay, so one of the things is it filters. The other thing it does is it warms the air coming in. If the air is cold, it warms it. Now, how it does that is that the inside of your nose has lots of blood vessels, and the blood is at least 98 degrees, right? 98.7 degrees, because that's our temperature, our normal temperature. So it warms the air coming in if it's cooler than 98.7 degrees. And the last thing it does is it adds some moisture to it, because the blood has the ability, there's the fluid portion of blood is called plasma, and the plasma has the ability to leak out of the blood vessels if the air coming in is too dry. So if you've ever had a runny nose, right, that's the plasma leaking out of your nose, okay, and that's why you have a runny nose. So breathing through your nose is the better way, okay, and you accomplish a couple different things by breathing through your nose. You clean the air, you filter the air, you warm the air, and you moisturize or add fluid to the air. Okay, so those are the three things. That's very good, okay? Now, realize that small babies, probably under 2 years of age, okay, are what they primarily choose to breathe through their nose. The way God made them is to want to breathe through their nose, because obviously they feed by breastfeeding, right? So they're suckling at their mother's breast for, I don't know, 10 to 30 minutes at a time, and they wouldn't be able to hold their breath. If their mouth is attached to the nipple, they still have to breathe. So that's why they choose to breathe through their nose. Now, why that's important for us is that you've all seen your kids with stuffed up noses, and they look like they're having a lot of trouble to breathe. So they don't naturally start to breathe through their mouth the way we do when our nose is stuffed. So when you have a small child that has trouble breathing and you see their nose all stuffed up, you actually have to take like a washcloth with some warm water on it and start wiping away the mucus. And we actually have, you probably even have them at home, but we have like devices that spray some water up the nose to kind of loosen the mucus so that it becomes easier for them to breathe. Okay. So we breathe through our mouth and our nose. Let me see if I have a good picture coming up. Okay. So here's our nose, and this is what's called our nasopharynx. So when somebody said before that your mouth is bigger, the opening of your mouth, if you fill in the tongue, is actually smaller than your nose. The reason why it feels more comfortable to breathe through your mouth is that even though your nasopharynx, the back of your nose, right, this is the part we don't see. This is the part of the nose we see. even though we don't see this and realize how big it is, the problem is that the opening, right, your nostril is the restricting part. So that's why sometimes it feels like it's harder to breathe through the nose, but the actual opening is larger than the opening of the mouth because the tongue fills up most of the mouth. And you can see how the tongue is attached to your lower jaw or your mandible, right? So if you were laying flat, okay, and you were sleeping or you were unconscious because of some reason, the tongue actually will slide backwards and close the ability for air to come in. And that's the snoring sound you hear when it's partially blocking your airway. This up here is showing you the turbinates. You see how it looks like there's shelves or little steps in here? So when the air comes in, and remember your nostril here is divided into two sections, right? You know, when you look up your nose, it's divided into two sections. So there's two sides to it. So we're only seeing one now, but the air comes in and starts to spin around in here. And what you don't see is the hair and obviously the mucus that is trapping the pollution. Okay, so whether you breathe through your nose or you breathe through your mouth, air comes into your throat, okay? So the whole term for your throat is called your pharynx. So here they've divided the pharynx. See pharynx with a P, pharynx and pharynx. They've divided your pharynx into three divisions. Nasopharynx is the part of your throat behind your nose. Oropharynx is the part of your throat behind your mouth. And laryngopharynx is the part of your throat right before it enters into your trachea or your windpipe. Okay. Now you're going to learn nasopharynx and oropharynx because we have airways that we insert in people, and they're called a nasopharyngeal airway or an oropharyngeal airway. Okay, because that's where they go. Most people abbreviate them because it's easier by saying an NPA, nasopharyngeal airway, or OPA, oropharyngeal airway, because it's just easier for people to say it than these big words. But we have airways that we can stick in here to help us get more air down into a patient if they're unconscious. Okay, so air comes in your nose and your mouth, goes into your throat. Now your throat is the tube where you can have both food and air in at the same time, right? Because if you're eating and breathing, which we all do at the same time, you can have food, that was this little yellow thing is supposed to look like. You can have food and you can have air at the same time, up until this point right over here, where we have to decide, is it the air going to go into the windpipe or is the food going to go into the food pipe? The windpipe is called the trachea. The food pipe is called the esophagus. Most of your time, your food pipe is actually flat. It doesn't look like a tube. It's just a flat tube. Looks kind of like a garden hose that was flattened. And the reason why is there's muscle in here. And when food enters to it, it actually starts to squeeze the food and move it down the food pipe. Where your trachea is actually held open by little rings of bone called cartilage. So your trachea never really collapses, or else it would be difficult. Like every breath, you'd have to take a huge, exaggerated deep breath to open up the tube if it was flat each time. Okay. Now, this structure right here is called your epiglottis. Epi means above, and the glottis is the opening to the trachea. Okay. The whole structure of the top of the trachea or your windpipe is called your larynx. Okay. So epiglottis, right here, this little word, okay, going here. So what this is a little bone that's held in by a piece of muscle. And when you swallow, like you want to swallow water or food, what happens is your trachea starts to move upward. Your windpipe starts to move towards the epiglottis. The epiglottis starts to move towards the trachea. And this flap actually closes off the opening to the trachea. So what does the food or water do? It slides backwards down into your esophagus, your food pipe, so you don't get anything but air in your trachea. And it works perfectly, except when we talk and swallow at the same time. So in other words, if we're having dinner with someone and we're having a conversation with them, okay, and we are chewing our food at the same time we're talking, and then we go to swallow, the way this device works is it always is preferential towards air, right? Because air keeps us alive. So if we're trying to swallow while we're talking, it's going to be in the upright position to let us talk. And then when we swallow, that's how we choke, right? Because it's in the upright position and we're swallowing and the food is still coming down. So that's why it's always obviously important that, you know, while you're eating, that when you come to chew your food and swallow your food, you stop talking so that it goes back in. Typically, choking occurs when there's food, people around, and alcohol, because alcohol slows your reflexes, right? But I mean, kids can choke just because they eat too big of a piece of food. What else do we have here? Oh, somebody asked a question. It says, what happens when you cough? So coughing is a protective mechanism that if the body senses something starts heading towards the trachea that doesn't belong, whether it's water, dust, or anything like that, it will make you cough. Or also you will cough if there's stuff inside your lungs, like you got an infection, you got a cold, a pneumonia in your lungs, and there's too much mucus, you'll cough to get it out also, okay? Now there's two things, there's coughing and there's gagging. So if you were ever swimming, okay, and somebody shoved your head under the water and you suck some water and it touches this area where only air should be, it will cause you to gag, to spill the water, to shoot the water back up, okay? But a coughing is more something coming from deeper in the lungs. So gagging is more upper, okay? Coughing is more lower, okay? But they're protective mechanisms. So that's a good question, okay? So if the test says to you, what's the structure to protect the airway from things that getting into it, to prevent things getting into it that shouldn't get into it, it would be your epiglottis, right? So it protects the airway, the trachea, from anything entering it except air. And it works that when you swallow food or water, combination of the trachea moving towards it and it moving towards the trachea, it closes the opening to the trachea off so that food will go towards the back, which is the esophagus, okay, and it'll go down into your stomach. Okay, so that's a lot. Does anybody have any questions on how this works, or do they want me to explain it again a different way or something like that?
One question.
Yes.
On top, so when you look into your mouth, there's this little, like a little something hanging down from the top.
That's something else. That's called
Sorry, I couldn't hear what you said.
That's called your uvula, and that is part of your immune system. It's kind of a cleaning, protecting type of structure. It's not your tonsils. Sometimes people think it's your tonsils, but it's called your uvula. And it's almost like, you ever walk in the bathroom and there's that thing up on the wall that's spraying stuff out to make the room smell nicer or kill germs. So your uvula is the same thing in the back of your throat. It's kind of part of your immune system. Your immune system is the part of the system in your body that protects you from infection. So that's what that is. So you can't see it here because it's not, it's not visible.
How does it connect with the immune system?
It has stuff that comes out of it that helps to fight infection. So it's kind of releasing cells that fight infection. Okay. Somebody asked a question, can smaller pieces of food stay in the trachea without messing it up? So the only thing that's supposed to be in the trachea or in the windpipe is air. So is it possible that you get something in there, okay, and it gets stuck? Yes. Nowadays they have ways of going in and removing it without cutting into it. There's tubes, there's like camera tubes. They can go down with little grabbers and pull things out. It's called bronchoscopy. But years ago, I'm sure, before these devices existed, that, stuff got stuck there. And what the body will do if there's something where it doesn't belong is it actually covers it up and coats it to like cover it up so that it can't do any damage. So it probably wasn't a good thing. And just remember, anytime you have like you screw up things in the body, there's always a chance that those things can become cancerous. So you never really want stuff in your body, that changes cells, because all cancer is cells. Cells are like the smallest structures of the body. We're made up of billions of cells. So all cancer is that cells have changed, in their normal form. So that's really all most cancers are. Okay, so let me go back up. Okay, so I think we're over here. Just see somebody's texting. Okay, so going back again, we said as far as structures go. So the larynx is the top of your trachea, the top of your windpipe. So that's where your epiglottis is, that structure we said that protects you. It also contains a structure called your voice box, and that contains a structure of bands, these little bands called vocal cords that vibrate and make sound. So remember when we were talking about assessing someone who's choking, and we said we can determine if someone has a complete airway obstruction by asking them to speak. So the concept would be is that if somebody can make sound, it means air has entered their larynx. And since the larynx is the top of your trachea or windpipe, it's gotten air to tubes that go to the lungs. So it should, you can't be choking if that happens, is what, basically we're saying. Okay, now we have two structures on the neck. Let me just go back down here. We have two structures, two bumps on the outside of the neck that you see. The top structure is called your thyroid cartilage. If you see, it kind of lines up just about to the opening where air comes in. And you have another cartilage. Cartilage is a soft bone. Okay, you have another cartilage called your thyroid cartilage. So they're right here. This whole structure here is called your voice box, your larynx, right? This is what we're talking about. This is where you make sound as air goes through. So your thyroid cartilage on men is that bump you see in the front of your neck. Women also have thyroid cartilages, okay? But it's more prominent, it's more visible on men because men have a bigger voice box, which gives us the deeper voice than women have. It's just the way we're made, okay? But we all have thyroid cartilage, we all have cricoid cartilage, and that's just the structure right over here that we're talking about. Okay. Okay, so your trachea was the tube that brings air in. The lungs are the structure that you use for gas exchange. And when the trachea comes down into the lungs, it splits into a right and left tube, which is called a bronchus. And then those bronchus split into smaller tubes called bronchioles. And at the end of every bronchiole is the air sac where gas exchange takes place. And that's called an alveoli. Okay. And I'll show you pictures of what it looks like. This structure of a trachea, a bronchus, and a bronchiole kind of looks like the roots of a tree, right? So it's a big tube, smaller tubes all the way out. Your diaphragm, we said, is the muscle that separates your chest from your abdomen, and it's the main muscle that we use for breathing, okay? So what they're showing you here, okay, this is the top of your trachea, which is your larynx. What you're looking at right here is your thyroid cartilage or your Adam's apple. Inside this structure is your voice box to make sound, is also your epiglottis to protect this airway. Your epiglottis sits right up here, so that would stop anything but air from going in here. Okay, and then you had your thyroid cartilage. This little band here is your cricoid cartilage. Comes down into your trachea, which is a rigid tube because it's made up of cartilage. Okay, and then when it enters into close to your lungs, it splits to a right bronchus and a left bronchus to bring air into the trachea. And once it enters into the to bring air into the lungs. And once it gets into the lungs, they split further and further and further. So your lungs are not sacs. They're not like bags. Your lungs are actually solid organs that have miles and miles and miles of tubes in there. And all those tubes have sacs on them that allow you to have gas exchange. So your lung actually looks more like a sponge than it looks more than a bag. It's not really a bag that we kind of think like we think it's a sac of air. It's not.
Is this what bronchitis is? About the
Bronchitis is when you get an infection in the tubes. A pneumonia is an infection actually in the lung itself, the tissue of the lung. A bronchitis is always, like an inflammation or infection. So a bronchitis is in the bronchioles when you get it in the actual tubes. So, I mean, same basic problem for us. It's just that, it's located in different parts. Okay, so we said the nose and the mouth. So really the nose is what warms, moistens, and filters. It's not in the mouth. Okay, so this is incorrect. So the nose is what warms, moistens, and filters air as it enters the body. Okay, then air travels through the nasopharynx and oropharynx, which is the part of the throat behind the nose and the part of the throat behind the mouth. Okay, into the main part of the throat, okay, the main pharynx. And then below that, the pharynx splits into the front tube, which is the windpipe or trachea, and the back tube, which is the esophagus. And we had that epiglottis between the throat and these two structures, which guides the food to the back to the esophagus and only lets the air go into the trachea. Okay. The larynx is the top of the trachea, and it houses the vocal cords. And right above the larynx is the epiglottis, right? That kind of shoves the food to the back to the food pipe. Okay. So again, the epiglottis protects the trachea from liquids and foods. It only allows air, okay? And it doesn't work that great when somebody has what we call an altered mental status, when their brain is not working right. So that's when people wind up having problems and choking and aspirating vomitus into their lungs and all that stuff. Remember, aspiration is the medical term for getting something into your lungs that it doesn't belong there. And since the only thing that belongs there is air, it could be vomitus, it could be food, it could be a kid could pick up a little, toy, a wheel from a matchbox car or something like that, and that's what we call aspiration. Okay, the bronchi are the two tubes that start when the trachea gets down towards the lungs, and you have a right main stem bronchus that goes into the right lung and a left main stem bronchus that goes into the left lung. And then once the bronchi enter into the lungs, they divide into smaller tubes called bronchioles. Okay, so it's all kind of sounds the same. I know it's, a little difficult for the first night. Okay, so this is what we looked at before, that when we breathe through our nose, it filters, it warms, and it moistens. When we breathe through our mouth, probably moistens a little bit because we do have saliva, but it doesn't warm and it doesn't clean. Okay, so it comes in mouth and nose. Okay, we had our nasopharynx, which is the throat by the nose, the oropharynx, which is the throat by the mouth, and the laryngopharynx, which is the throat right before it splits into either the trachea, okay, which is the windpipe, or the esophagus, which is the food pipe. Remember, everything above here, you could have food and air, but once it gets to this level, air is directed to the front, food is directed to the back, unless there's choking. Okay, so we said bronchioles have smooth muscle, right? So they're involuntary muscles, which means we don't have to think to do anything, right? They work on their own, but they do have the ability to constrict, like when somebody's having an asthma attack, and if they constrict, constriction means they get tighter. So you don't want a tube that air is going through to get tighter because it becomes harder to breathe. Okay, so, and we'll talk all about asthma and all different types of respiratory emergencies. And we have drugs that we give patients to relax that bronchoconstriction, that's that tightening of the air passageways to allow them to breathe better. Okay, now we have miles and miles and miles of these bronchioles. I know it's hard to picture having, miles of tubes inside just your chest, but we do. They're very small, okay? And they all end, and when they talk about something being microscopic, it means it's so small that you need a microscope to see it, but they all end, all these tubes, and they get big, they get smaller and smaller and smaller, and they all end on a little tiny sac called an alveoli. And inside that sac is where the gas exchange between the oxygen and the carbon dioxide takes place. And wrapped around the outside of these sacs are blood vessels called capillaries. Capillaries are paper-thin little blood vessels that have the ability to let things in and out of them, okay? And obviously, when they're wrapped around the alveoli, what they're letting in and out is the oxygen and the carbon dioxide, because this is the whole reason we have a respiratory system. This is showing you a normal bronchiole, which is an air tube. And this is showing you a bronchiole in somebody who had, let's say, bronchitis or asthma. So two things are happening. It's gotten tighter. It's constricted because, again, there's smooth muscle. So it's going to be harder for that patient to breathe. Plus, there's more mucus because when you get sick, the body starts to produce more mucus to kind of protect the airway. And that mucus can dry out and clog up the airway. So that's what's kind of showing you here. And sometimes it's so tight and hard to breathe that we actually wind up getting painful breathing because we bruise our muscles so much by coughing and trying to, get air in and out. Okay, the lungs are the actual organs of the respiratory system where the gas exchange takes place. And there's thousands and thousands of these little tiny air sacs called alveoli that take place in there. Okay, don't worry about pleura or anything like that. We won't worry about that right now it's too much for tonight. The diaphragm, we said, is the muscle, okay? And when they say it's dome-shaped, it's kind of rounded, okay? That separates our chest from our abdomen. And so your thorax, your chest from your abdomen. And the way we basically breathe is this, okay? So it's a very simple procedure. Your brain, which is the master computer of your body, okay, is monitoring the level of carbon dioxide, which is a waste product, right? That's the waste that we need to get rid of when we burn oxygen to make energy. It's monitoring the level of it in the bloodstream. And if it finds the level is getting high, it makes you breathe more. And if it finds the level is getting less, it makes you breathe less. So the reason why, if it's more, it makes you breathe more is that since it's a waste product, it's something we want to get rid of, okay? So again, your brain is monitoring the level of this gas, like a meter, right? Like, you know, you have a gas meter or something like that's monitoring it. If it finds the level of carbon dioxide is rising, okay, it will make you breathe more. And how it will make you breathe more? Not only will it make you breathe more times a minute, it'll make you breathe deeper, so you bring more air in, right? So one is the respiratory rate, how many times a minute you're breathing, and one is how much air you're normally bringing in. So at rest, we bring in about this size bottle of water. So this is like a regular size bottle of water. It's 500 milliliters of air that we bring in at rest. Okay, so it's not a lot. Obviously, if we got up to run, we would bring in 2-3 times of this. Your lungs have the ability to have 6,000 milliliters. So if this is 500, it means you could have, sorry, I'm a little tired tonight. It would be 2 to 1,000, so it would be 12 of these, the capacity of 12 of these in your lungs. So 6 in each lung, okay? You have 6 bottles in each lung of total capacity, but with each breath, you typically just move 1 of these bottles, okay? Now, obviously, it's not water, it's air in there, but I'm just using it for comparison, okay? So again, how do we breathe? We breathe that our brain is monitoring the level of carbon dioxide. If it finds the level of carbon dioxide is rising, it's going to send a signal to 2 sets of muscles. The first set is your diaphragm. So your diaphragm is the muscle that separates your thorax from your abdomen. And then you have what's called intercostal muscles. So inter means between and costals mean ribs. So these muscles are found in between your ribs, and you have 12 pairs of ribs on each side, and they actually go this way across your chest, your upper chest also. And what your brain tells those muscles to do is to constrict and get tighter. So picture what happens now. I have to breathe, and it's going to tell my diaphragm to constrict, which means it's going to go downward towards my belly, okay? And it's going to tell my intercostals between my ribs and over my ribs to contract, and it's going to take my ribs cage, my chest, and expand it. So the bottom part is going to drop down. This part is going to expand. So if you looked at the thoracic cavity as like I don't know, like a tub, like a compartment, the actual size of the compartment increases. So if the size of the compartment increases, the pressure inside the compartment has to decrease. So all it needs to do is make the pressure inside your chest lower than the pressure in the room that you're in. And if the pressure inside your chest is lower than the pressure in the room you're in, what will air do? It will go from an area of higher pressure to an area of lower pressure. And what do? You breathe, right? So all I have to do is make my inside of my chest, the pressure inside my chest lower than the pressure in the room, and air will flow into my lungs. And then those muscles relax and your chest gets tighter, so the pressure inside your chest gets higher than the pressure in the room outside. And what do? You exhale, you breathe the air out. And that's all breathing is. So breathing is a combination of your brain monitoring the level of carbon dioxide and then sending signals to those muscles to change the pressure inside your chest. How they change the pressure inside your chest is by constricting to make your chest bigger. When they pull and they get tighter and muscles get tighter, they pull and make your chest bigger. And then once you get that air into your lungs, they relax and make your chest cavity smaller, so the pressure increases higher than the room and you exhale. And that's all breathing is. Okay, so how many people are ready to quit? Is it making any sense? Any questions? Okay, let's try to finish the respiratory system tonight. It's 9:30. I know we've been going for an hour and a half. Okay, but let's just try to get through the respiratory system tonight, and then we'll go from there. Okay, so this is what your thorax or your chest looks like. It is filled to its entirety by lung and by heart. So you have 2 lungs, and in between is your heart. Okay, and you're squeezing in your trachea and some blood vessels. This is your diaphragm. The mediastinum is just a term for this section of your chest in the middle, so don't worry about that. So your trachea comes down, it splits into 2 bronchus that we don't see, 2 main tubes that go into your lungs, and they split into smaller and smaller ones. Your lungs are in tight contact, okay, with the sides of your chest, so really with your rib cage, right, with your ribs, and it's basically pressed right up onto the inside of your chest. And the reason why is that, have you ever seen if you take something very smooth and put it on top of something very smooth? So you take a piece of glass and you put it on your kitchen counter, your smooth kitchen counter, whether it's granite or whatever. If there's a drop of water between that piece of glass and the kitchen cabinet, what happens? It actually sticks to it and you can't pull it off. You could slide it right and left, but you can't pull it off very easy. So the same thing happens now with the lung to the rib cage, is that there's a tiny little bit of fluid that we all have between the lining of the lung and the lining on the inside of the rib cage. And when those muscles contract, like I told you, the diaphragm and the intercostals. So when the diaphragm contracts, it goes this way. When the intercostals contract, they go this way. And what do they actually do to the lung? They take it and expand it and stretch it. And by expanding and stretching it, what do they do to the pressure inside it? If you have a bag, okay, that's filled with air and the bag is this big, there's a certain amount of pressure inside that bag. If you have the same amount of air, but the bag is this big, the pressure inside the bag has to be less, right? Because there's more space. And it's exactly what we do with our lungs. And that allows air now to come into our lungs, okay? So again, breathing is a combination of two things. It's the monitoring of a gas, which is carbon dioxide. If that gas is too high, the brain sends a signal to these muscles, okay, to start constricting to allow air to come into the lungs. And how it comes into the lungs is when the muscles constrict, they make the chest cavity as a whole bigger so that the pressure inside the chest is less. And once the pressure inside the chest is less than the pressure outside in the room, air will go from higher pressure to lower pressure. So the pressure is higher here, it flows in. Then once it equalizes, the pressure equalizes, the brain will tell the muscles to relax. They'll start to squeeze inward. They'll make the pressure inside the chest higher than pressure in the room, and air will flow out. And that's all breathing is. And, you know, obviously in a simplistic explanation, but that's all it is. Okay. Now, this is showing you where gas exchange takes place. So even though these look like they're big, these are the tiny tubes. These are like very, very, very small, like hair-like tubes. Okay. At the end, they started at the trachea and they came down and split into two big tubes that went into the lungs. Those two big tubes split into more and more tubes. And all the tubes eventually end in little tiny tubes that have these air sacs at the end. Now, they're not true sacs where they're one just big bag. They're a sac with multiple rooms inside of them. And every one of these walls has the ability to have gas exchange. And what's wrapped around these alveoli are a series of blood vessels. And the reason we have to have this is that getting air into your lungs is not enough. That air that gets into your lungs, that oxygen that gets into your lungs has to be transported to all the parts of your body, to all the cells, all the different organs in your body, and it's transported inside of the blood. So you see one side is red and one side is blue. So when you see something drawn in red, it means it's high in oxygen. And when you see something drawn in blue, it's low in oxygen. So what it's trying to explain to you is that the respiratory system and the cardiovascular system, the heart and the blood vessels, work together to get oxygen to all parts of the body. The lungs bring the air in, the blood vessels pick up the oxygen and transport it to the body. Once that oxygen is used up, it brings the carbon dioxide back, puts it back into the lungs where you exhale it out. So it's a combination of your respiratory system and your heart and blood vessels all working together to bring in oxygen that we need as the fuel. Remember, oxygen and sugar, we said, are the fuels of the body. And to remove the fuel, the waste product of the fuel. Like if you kind of think of a car engine, for a car engine to make your car go, it needs something, right? It needs oxygen and it needs gasoline. So you have to have air coming in and you have to have gasoline and you have to have a spark to make an explosion, right? A fire. And you can't have fire without oxygen. So when that whole thing takes place, that you have air coming in, gasoline, and that spark, the engine turns, and then the waste product goes out the tailpipe, out the exhaust, out of the back of the car. So we're kind of the same thing. We don't have gasoline, but we have oxygen and sugar that we use to combine to make energy. And when we make that energy, it makes the body stay alive. And then we have the waste products. And the waste products are carbon dioxide that we exhale. Okay. and other things that we urinate out of the body, that we get rid of out of the body by urination. Our kidneys clean it out of our bloodstream and get it out of the body. So it's the same concept that we're burning fuels to make energy, just like your car is burning fuels, or your radiator in your house, your boiler or your furnace in your house is burning, natural gas and oxygen, or oil and oxygen, and then the waste product is going out your house, out your chimney, right? Okay, so showing you the whole structure again. You could breathe through your mouth and your nose. It comes into your pharynx or your throat. Okay, remember in the other slide, they had divisions of your throat: your nasopharynx, your oropharynx, nasal behind the nose, oral behind the mouth, okay, down into your pharynx. And then it goes into your trachea. Since we're only talking about the respiratory system now, we're not going to mention the esophagus, which is the food pipe. So it goes into your trachea, okay, which is your big tube. That big tube splits into two other big tubes that go into your lungs. And once it gets into your lungs, it splits into miles and miles of smaller tubes called bronchioles, and all of those smaller tubes end in an air sac called your alveoli, and wrapped around your alveoli are a series of capillaries, which are small, thin blood vessels, and that's how you have the exchange between the respiratory system and the cardiovascular system. The oxygen and the carbon dioxide, okay, connect there, and that's how we bring the oxygen into the bloodstream and the carbon dioxide out of the bloodstream, which you exhale out of the body. Okay, so ventilation is just a term for the movement of air in and out. But when you actually have the exchange of the gases, the carbon dioxide and stuff like that, that's called respiration. Okay, and this whole thing, physiology is like the function of it, that is working together. That oxygen, which is good, and carbon dioxide, which are bad, are exchanged through the alveoli. So obviously you want to bring oxygen in and carbon dioxide out. Okay, and it's exchanged between the respiratory system at the alveoli and the cardiovascular system between the capillaries. Remember, respiratory breathing, cardiovascular is the heart and the blood vessels that pump the blood. So cardiovascular system is made up of a pump, which is the heart. It makes up tubes, okay, which is the blood vessels, and it's made up of a fluid, which is called blood. So everything has to work. Everything has to work in conjunction.
That's an interesting question.
Mm-hmm.
If the moving air in and out to the lungs is called ventilation, so what is the respiratory arrest? Isn't it a ventilation arrest?
You're right. So you're going to find in medicine, okay, first of all, I'll tell you one thing. In class, if you think too much, you're going to make yourself crazy. So it's not Gomorrah. You don't have to analyze it, okay? There's going to be a lot of things in medicine that make no sense. There's going to be a lot of terms that I'm going to tell you, and because you think, you're trained to think a certain way all your life, you're going to get very confused by it. And I'm going to tell you, don't make yourself crazy. It's just the way it is. So, there's just some crazy terms out there. I don't know why they are that way, but you're right. A respiratory arrest should really be a ventilatory arrest. And you're absolutely right, because it's not a problem. Well, it is a problem with gas exchange, because if you're not moving air, you don't have gas exchange.
Right.
But the primary problem is ventilation. It's not the gas exchange to start with. Okay, but don't make yourselves crazy. Okay. So again, ventilation is the mechanical process of moving air in and out. And we said that's accomplished by muscles constricting your diaphragm and your intercostals and changing the size of your chest so that the pressure inside your chest becomes less than the pressure in the room, and that brings air in. And then it makes your chest smaller, so you increase the pressure inside your chest and exhale. Okay. Okay. And then ventilation, again, is just based on pressure, right? So now on the test, they're going to say to you, what part of ventilation is the active phase and what part is the passive phase? So active means something's happening. And on inhalation, we said the muscles are contracting. So inhalation is the active phase, okay? And exhalation is the passive phase, because the muscles are just relaxing. There's nothing, it's just a natural, like if something stretches and it goes back into the normal position you originally found it. So in inhalation, that's where the muscles are doing something actively. They're actually getting bigger, tighter. They're expanding the chest, okay? Where in exhalation, they're just going back to the shape they're always in. So that's considered the passive phase. So again, what happens in inhalation? The diaphragm goes down, right? So here's your diaphragm. Your intercostal muscles go outward. And the combination of those two things expand your rib cage and take the lungs with it. And they make the size of the lungs bigger. So the pressure inside your chest is less than the pressure out here. And remember, water and air go from high pressure to low pressure. So if the pressure out here is higher than the pressure in here, air will flow in. That's inhalation. As soon as the pressure gets equal, the muscles will relax and now press down and up on the lungs and increase the pressure inside the chest higher than the pressure in the room, and you'll exhale. Okay, so that's it. So they're saying here negative pressure pulls air in. So what you mean is that
you say that
when you
that,
increase
that
the
when
size
you
of the chest,
expand,
hold on one second. When you increase the size of the chest cavity, you make the pressure inside the chest negative, lower, and air comes in. Okay. Now, what was your question?
I thought that when the diaphragm pulls, that's when the air comes in. It's
Yes.
not that you open it up and the air automatically goes in. You pull in the air by
So yes, when your diaphragm goes down, okay, and your intercostal muscles go out, you make the pressure inside your chest less than the pressure in the room, and air flows in. Yes, it's not really the diaphragm pulling the air in, it's the diaphragm making the size of your chest cavity bigger. And when it makes your ribs go out, your lungs on the inside are attached to those ribs because of that little bit of fluid, okay? And it pulls, when the ribs pull, it pulls the lungs with them and expands the lungs, expands those sacs so that the pressure inside those sacs now becomes less than the pressure in the room outside, and air comes in. Okay. Okay, so your diaphragm is the main muscle of breathing. So about 60–70% of the force of breathing is from your diaphragm. Your intercostals are the rest. Okay, and if you have any problem with your diaphragm, you're going to not be able to use it to be able to breathe. So most people never have any problems with their diaphragm. The big issues would be is if you have a very, very heavy patient and they fall flat on their back. So something happens, they faint, they're so heavy, they slip and fall and they wind up on their back. They could actually stop breathing, because what's going to happen if you have a very heavy person and they're laying flat on their back and they're so heavy they can't actually get up, what's going to happen? The weight of their stomach is going to do what? It's going to press on the diaphragm and not allow it to work. And therefore, they're going to go into, at some point, they're going to have a big respiratory problem, a big breathing problem, because they can't move enough air. Now, when somebody has an injury to their spinal cord, remember your spinal cord is what travels through your spinal column. Your spinal column was, when we looked at the bones, were the different 33 vertebrae, okay, that make up the spinal column, and down the middle of the spinal column is your spinal cord. Your spinal cord, I said, is the connection between your brain and the rest of your body. So if you think it's like you guys that are in the computer world, it's kind of your brain is the server and your spinal cord is the main connection from that server to all the other computers in the network, right? So what they're saying here is that if somebody has an injury, okay, to the nerves in the neck, right? So C3 is cervical 3. Remember, you got 33 vertebrae, and the first division was a neck called the cervical. So C1, C2, C3 up to C7, because there's 7 cervical vertebrae. So they're saying that if there's an injury up in the neck, the nerves that would send the signals to the diaphragm and the intercostals would be interfered with, and a patient would not be able to breathe. And that's one of the big problems when somebody has a spinal cord injury. It's very difficult for them to breathe properly because the signals from the brain don't make it to the muscle that's supposed to tell it to do something. Okay. Again, it's just showing you here the muscles that work to breathe, right? So we had the intercostal muscles that we said are between the ribs and over the ribs. The internals are between the ribs. The externals are across the ribs. And then we had the diaphragm, which is a dome-shaped or bell-shaped muscle that separates our chest from our abdomen. And when you breathe, this muscle contracts downward. So you can see already how it makes the chest bigger. And these muscles pull the rib cage outward, okay? And it makes the whole chest bigger. And obviously, since the lung is on the inside of the chest, it takes the lung with it and expands the lung so that the lung itself gets larger and the pressure inside it drops down.
Where does the heart go between all this?
So the heart
When
is
it
sitting,
expands?
the heart is sitting in a notch, basically like right over here. It's in a little right behind the sternum, because you know you're doing CPR, you're pressing on the sternum, right? So it's
Right, but what happens when you inhale? When you inhale, and it expands, the
what's
heart.
what's happening to blood flow? Is that what you're saying? So
No,
when you increase the pressure in your chest, it actually becomes harder for blood to pump. That is a problem. That is true. So when you breathe in, okay, and you're increasing the pressure inside your chest, less blood is getting pumped out of your heart than when you're exhaling and there's less pressure in your chest. But overall, your heart still works fine. It's not an issue. We could actually cause a problem when we talk about ventilating people and we start using devices to ventilate people that are not breathing, like the bag valve mask and so on. We could actually cause a problem by overventilating someone and increasing the pressure. So in other words, I said we normally breathe 500 mLs, right? About this much. The bag valve mask, the device we use to ventilate someone, has between 800 and 1,000. So it has almost 2 times this capacity. So if we squeeze that bag with too much force and put too much air into their chest, we have 2, problems that could occur. One is we could actually burst the lung. The other thing is that we can just increase the pressure inside the chest so high that the heart does not pump effectively because it can't push blood out against this higher pressure that exists inside the chest. So that's a good question.
Lining of the outside lining of the heart is also connected to the rib, like the lining of the lung.
Nope, the heart does not have to expand the way the lungs do. Nope. The heart is actually in a very, very tough sac that totally protects it from like any kind of pressures, or any kind of interference from the outside. So your heart is in a super tough sac that for the most part does a good job in protecting it. So you don't really have to worry about any of that kind of stuff.
And that's why by ventilating a patient with a BVM, you're not compressing it all the way because it has about double.
Nope. You're compressing it just till you see the chest start to rise. Like if you looked at yourself breathing right now, right? If you were videotaping yourself, you barely see your chest moving with normal breathing at rest, right? You barely see it moving. So the same thing when we're ventilating someone, we ventilate them just till we see the chest start to move.
And that's about a halfway of the BVM of the.
Depends on the seal. In other words, you have to have a good tight seal between the mask and the patient's face. So yes, if you had a good rock hard seal, then it's about half. Yes. Mm-hmm. But they give you more ability, like more, the bag is bigger because if you have a poor seal, like let's say, you all have facial hair, right? So it's going to be harder to make a seal on your face because you have that facial hair that's not allowing the plastic of the mask to adhere to your skin. So they have to make the bag have more capacity in those situations where you're having a hard time making a seal. Okay?
Yeah.
Okay, so it says oxygenated blood is carried carried from the lungs to the heart and then is pumped to the rest of the body. So what's saying now is that breathing worked perfectly. You got air through the trachea, through the bronchioles, down to the air sacs. Okay. Then that air crossed out of the air sacs into the blood vessels that are the capillaries wrapped around it. Okay. And entered into the bloodstream. And then the heart pumped that oxygenated blood, okay, to every part of the body that needed it. And really every part of your body does need oxygen and every part of your body does need sugar. So at what they say at a cellular level, right? The cells are the smallest. Think of like every cell is a kind of little power plant in the body. So you have billions and billions of cells, okay? And every one of them makes energy to do something. So like the cells in your heart make energy to make your heart pump. The cells in your lungs make energy to make your lungs work, right? The cells in your skin, okay, make energy to keep your skin intact. So every cell, it doesn't matter where it is in your body, it's a specialized, a skin cell is different than a heart cell. So, but it all has the same function, which is that it's designed to make energy to keep its organ alive, right? So like the cells of your eye are designed to keep to make the eye see and to keep the eye alive, okay? So again, oxygen is, since we're talking respiratory, is the good part and carbon dioxide is the bad part, okay? I shouldn't say bad, but basically it's what's left over after the oxygen combines with the sugar in the cell to make energy. So a cell will burn oxygen and burn sugar together to make energy. That's what it does. And then once you make that energy, deoxygenated means blood with low oxygen, right? Oxygenated blood means high oxygen. Deoxygenated means low oxygen. So the used up blood returns back, okay, to the heart. Then it goes from the heart to the lungs. And then you exhale the carbon dioxide out of the body and bring in fresh oxygen. So CO2 is the abbreviation for carbon dioxide and O2 is the abbreviation for oxygen. And that works, obviously all day, every day you're alive, whether you're asleep, okay, or awake, it's working. Obviously, if you're doing something that makes you need more oxygen, then you're going to breathe deeper and faster, and your heart's going to beat faster to circulate that more oxygen around. So if you all got up now and started running around, right, your respiratory rate would increase and your heart rate would increase because you need more oxygen than you do when you're at rest. Okay, so let's just talk about a couple more things in the respiratory system, then we'll call it a night. So what is the adequate amount of air to breathe in? So the term of breathing air in one breath, the amount of air is called tidal volume, like the tides of the ocean, right? The waves coming in and out, high tide, low tide, right? So tidal volume is the amount of air you bring in with one breath. So I said already that most of us bring in between 400 to 500 mLs. Women more about 400 mLs, men about 500 mLs. mLs mean milliliters. It's just a measurement of volume, right? So this bottle has about 500 mLs in it, okay? And this would be about the air that we're breathing in with each breath. Our total lung capacity is 6,000. You have 3,000 milliliters in one lung, 3,000 in the other lung, but we only bring in about 500 mLs, okay? The amount of time that a person should breathe a minute is about 12 to 20, okay? When you get older, you tend to breathe a little faster. When you're younger, you also tend to breathe a little faster. The better shape you're in, the slower your respiratory rate is, okay? And the slower your heart rate is, because it doesn't have to work as hard to keep you going, right? The better you shape you're in. So you can get an idea of your overall shape by, at rest, measuring your heart rate and measuring your breathing rate. The slower it is, the better it is when you're at rest. Okay, and these are just rough numbers of what a child at rest would breathe and an infant at rest would breathe. So the younger they are, the faster they breathe, okay, because they need to bring in more energy because everything's growing. So when they say adequate breathing, that somebody's breathing well, means the time between each breath is the same. So the rhythm of it is the same, okay? There's no trouble, it's effortless, there's no pain, there's no difficulty in breathing. The chest expands equally, so both sides of the chest go up and sit down. There's no abnormal sounds, right? So you know that when you go to the doctor's office and you have a chest cold, they listen with the stethoscope and will learn all those different sounds. And there's no use of what they call accessory muscles. So an accessory is something extra, right? When you have an accessory. So the normal muscle of breathing is the diaphragm and the intercostals. An accessory muscle will be any other muscle that somebody uses to breathe except their diaphragm and intercostals. Now, you've never seen that, but when somebody's really, really having trouble breathing, you'll actually see the muscles of their shoulders working, the muscles of their belly working, because they're having so much trouble breathing. They're using every possible muscle they can to try to get, to change the size of their chest, the shape of their chest, so they can get more air in. And you've never, again, unless you saw somebody struggling to breathe, you've never really seen that. When we say inadequate breathing or breathing that's not good, okay, they're either breathing too fast or too slow, that the rate between each breath is irregular, that their lung sounds, their breath sounds are either very quiet, they're not moving enough air in, or absent whatsoever when they're not breathing, that maybe they have an injury to their rib cage or their muscles and they're not moving air equally, so the lungs are not moving equally, okay? Or you can see what we talked about the other night, which was that the skin can take a color when the oxygen level is low, and we mentioned that the mucous membranes are where the skin is thinnest in the body, and that's typically the lips. And you could see a bluish discolorization that was called cyanosis. And I said that, you see that when you have your kids in the water in the pool and they're cold, but it's not because they're having trouble breathing. It's because when they're cold, the body doesn't let a lot of blood towards the surface to try to conserve the heat. And since it's not letting blood towards the surface, and since oxygen is carried by blood, the lips turn blue. But when we're talking about a respiratory problem, it's that their lips are turning blue because they're just not bringing enough oxygen in, right? So that's a late sign of having trouble breathing. There are definitely differences between the respiratory system in children and adults. So the structures themselves are the same, but obviously the sizes of them, okay, and how fast they work are different. So in a kid, they have a smaller mouth and nose, obviously, in proportion to an adult. So it's more easy for them to be obstructed. Now, they don't have a larger tongue than an adult is, but remember how that tongue filled up, in the picture, it filled up pretty much the mouth. So in proportion to the size of a child's mouth versus an adult, their tongue actually fills up more of their mouth than ours does. And since the tongue is just a muscle, right? Your tongue is really just a muscle. And since muscles in kids are weaker than muscles in adults, it's much more likely for a kid who's laying flat and unconscious, okay, to have that snoring or partial obstruction of the airway. Their trachea, the cartilage that makes up the rings of the trachea, is not firm yet because they're, it hasn't had time to firm. So it's easier to, if pressures on the trachea, to close off the airway. The same thing, remember the cricoid was just part of the cartilage, okay? And the chest wall, the ribs cage and everything doesn't do as good a job as protecting as it does because, again, the bones haven't had time to get hard because they're soft so they can grow. And they mainly use their diaphragm to breathe. We use mostly our diaphragm, and then, say 60% diaphragm, 40% intercostals in adults. Kids, it's like 90% diaphragm, 10% intercostals. So if there's any problem with the diaphragm in a kid, it becomes a big problem for them to be able to breathe. And this is just, again, showing you problems with, the same thing we just talked about, but problems with the airway, or not problems, but differences in the airway with the kids and stuff like that. So again, the air passageways just being smaller and so on, the tongue taking up more space and stuff like that. Okay, so we're going to end tonight, but before we end, does anybody, I know you probably all have a million questions and stuff, but does anybody have any basic questions? Do you want me to throw out some questions and see if you could answer them? Or are you guys fried? So I tell you what, if anybody's fried and they want to just disappear, then just disappear. I'll throw out a couple different questions, okay?
Sure.
So let me ask you question number one. So we'll start at the top of the airway, work it down. What is it better to breathe through, your nose or your mouth? And then tell me why.
Nose.
Nose. Okay, now give me a couple reasons why the nose.
Filtration.
The nose is bigger.
Okay, well, nose is not, okay, so the opening to the nose is not bigger, but the passageway behind the nose, yes, very good. But the more important thing would be that the nose does a couple of things. So somebody just threw out the word filters, which is clean, good. So it filters, what else does it do?
Minerals or something?
No, it warms.
It warms
the air and it moisturizes.
Temperature?
It's fluid. So right, temperature, so it cleans, warms, and moisturizes. So if I'm saying a term that you don't understand, then say something, right? So moisturize means that it adds fluid to the air, right? We're not designed to breathe dry air. Okay, so now the air, preferably we breathe through our nose or our mouth, but better through our nose, it comes into our throat, which is called our pharynx, okay? And the throat in the back of the throat in the back now splits to two tubes. The front tube is the trachea, which is the windpipe where the air will continue to go. And the back tube is the esophagus, where air should not really go, but only food should go. And we said that at the top of the trachea, the structure is called the larynx. Let me actually go back a little bit so we could see it.
The larynx is the one that is the part that closes, that opens to the air and the food.
So the larynx is just a structure name. Okay, contained in the larynx is the epiglottis, which is this flap that closes it. And also, so the larynx is just a term for the whole area. And inside this area is your epiglottis, which is that flap, and also your vocal cords, which is what makes sound. So your larynx is like the top. Here's the start of the trachea, and your larynx is the start of the trachea, right? So it's right above the very top of the trachea. And when you look on their neck, the thyroid cartilage, the bump that you see on a man, the Adam's apple, is actually that area right there, that area of the...
That's a thyroid, correct?
The thyroid, yep. Well, the thyroid is a gland. So the thyroid is a gland that regulates what's called metabolism. And metabolism is basically when you take sugar and food and oxygen and make energy. Okay, so now air comes into your trachea. Okay, that's your front pipe, and that's held open by rings of cartilage. And then it goes down. So your trachea comes down. So this is still your trachea. It's about 7 to 9 inches long. Okay, and then it bifurcates. The term bifurcate means splits in medicine. So it splits or bifurcates into a right mainstem bronchus and a left mainstem bronchus. So those are just a continuation of the trachea entering in. They only go about, about here, a couple inches into the lungs. And then off of those big tubes come miles and miles of tubes, right? And the tubes start out bigger and get smaller and smaller as they travel through. And they all end, okay, on an air sac called an alveoli. And the reason why is that these alveoli have the blood vessels wrapped around them. And this is how the oxygen that comes in then enters the bloodstream to be circulated to the whole body.
It's not
How
that
does-
distribute between the O2 and how do you call it, CO2?
Yep, O2 is oxygen and carbon dioxide. O2 is oxygen, CO2 is carbon dioxide.
How does the clean air transfer to the blood?
So the walls of these alveoli are what they call paper thin. They're about, if you ever take an onion and start to peel apart an onion, you see how thin it's like almost see-through when you like peel apart the layers of an onion. So they're really, 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 really thin. So the oxygen is pressing up against the wall, and because the wall on the inside, obviously, right? So they're pressing from the inside against the walls, and they're so thin that they actually come out of the walls, and the blood vessels, the capillaries are very thin blood vessels too, and they actually cross over into the oxygen, leaves the structure of the alveoli and crosses into the blood vessel of the capillary and goes back to the heart to get pumped to the body. What else do we have? Any other questions?
What is the word capillary?
Capillary is, so it's a blood vessel. So let's just, let me go here for 1 second. Okay. So the next thing we're going to have to talk about is the cardiovascular system, because both of these systems work in conjunction, right? So you had your respiratory system that was your air passageways in your lungs. Now you have your cardiovascular system that's made up of a pump that's called your heart, blood vessels. So there's 3 types of blood vessels I'm going to tell you in a second, which are the tubes that the heart pumps the fluid, which is blood, through. The fluid contains the oxygen, the sugar, all the good minerals and vitamins, everything that needs to get circulated around. So, you know, how we get oxygen is by the respiratory system. How we get all the other good nutrients, the sugar and the vitamins, is by your digestive system, that you eat food, and out of the food you take that. Now, you have a couple different types of blood vessels. Blood vessels that leave a heart and are high pressure are called arteries. And we said that the largest artery of the body is the left ventricle, is the aorta, which starts at the left ventricle of the heart, and the left side of the heart pumps the whole body. That's why that's the strongest, biggest artery. So arteries bring blood away from the heart. And what happens is that arteries are thick-walled vessels because they have to survive, you know, higher pressures, because they, you know, the heart is pumping into them. So you can't really have gas exchange when you have thick-walled vessels. So what happens is that when the arteries start to get smaller and smaller as they get further out into the body, right when they reach the spot where they're supposed to bring, like, so every artery has, you know, a place where they're supposed to bring blood to. Right when they reach that spot, they change from an artery into a capillary, which is just another type of blood vessel. And a capillary is very thin-walled, so that it allows the stuff that's in the blood that needs to get into the cells of the body to transfer out of the cells into, transfer out of the blood vessels into the cells. And then once the cells make the energy, listen for 1 second, once the cells make the energy now, right, the oxygen and the sugar is used up, but there's a waste product, there's carbon dioxide and different waste products, they cross back into the capillaries to start heading back to the heart to be getting rid of. But then the capillary changes into a vein. So arteries bring blood away from the heart, and they always are high pressure and have a lot of oxygen. Veins bring blood back to the heart that's used up, so they're always low on oxygen. And in between an artery and a vein where the gas exchange takes place is always a capillary. And I think there's a picture here somewhere where it would show you that. Let's see. Somewhere there'll be a picture. Let's see. Okay. So what they're basically showing you is that you have, picture your heart being here. Okay. So the heart starts the flow of blood, and obviously off the heart comes that aorta, but every other artery, basically, just like you had the big tubes of the air and then smaller tubes, same thing with blood vessels. You have to start from the heart, off the aorta. And I think the other day I showed you how the aorta kind of arches and there's blood vessels off of it and stuff like that. Let me just show you here. So this is your aorta. So your aorta comes off your left ventricle. This is the big part of your heart. The left ventricle pumps up into the aorta. The aorta then arcs behind the heart along your spine and drops down to about the level of your belly button. Every other artery of the body ties off of this aorta. So you see like up here, there's other arteries coming off. These are the arteries that go up to the brain and the upper part of your body. And it would be the same thing as this artery comes. They don't show it, but there's many other arteries that come off of it, okay? Eventually, those arteries get smaller and smaller and smaller as they get towards the site where they're supposed to bring blood to, and then they change into a thin-walled blood vessel called a capillary. And that thin-walled blood vessel allows the blood to leak the stuff that it's carrying out into the cells, the sugar and the oxygen and stuff like that. And then the cells make the energy. They burn the oxygen, they burn the sugar, they make the energy, and then they put back into the bloodstream the waste product to be transported. So floating in your blood at any time right now is good stuff and bad stuff. And the body can separate what it needs to go where and how it gets rid of stuff. So it's like, picture like right now in our house, we have clean water coming in certain pipes and we have bad water, right, going out to the sewer. Your body actually has everything floating in the blood, good and bad, okay? And it's able to separate out and send the good stuff where it needs to go and the bad stuff where it needs to go, even though it's all floating in the same fluid. So it would be like as if you had, the garbage in the water and the good water all together, but when you opened your faucet to get water to drink, only the good stuff came out, okay? And that when the water was flowing towards the sewer, only the bad stuff went towards the sewer. So that's kind of how the body has that ability. So in the blood at any given time, everything's floating, but that everything knows where it needs to go, and the body only lets what it needs to go, go where it needs to go. What else? Oh, there's a ton of new messages. I didn't see this. 23 new messages. Okay, so let's see some questions we had. So somebody wrote, so the lung basically a term for a bunch of bronchioles? No. So this is the confusing part. The tubes that the air travel through are the trachea, the bronchi, and the bronchioles. The lung is the structure that everything's housed in. So picture you had this sponge, right? Sponge-like structure, and then running through the sponge-like structure are all the tubes and sacs that the gas exchange takes place. So the lung is the organ that contains all the different passageways and everything that you need to have gas exchange. So that was one question. What part is COVID affecting? COVID affects every single part of your body. That's what we're finding out now. Originally, COVID was mainly a respiratory lung problem, but now there's more people dying of blood vessels getting inflamed or clogged than really the lung part. So it'll probably be about 10 years before we really understand COVID and what it does and everything. In the beginning, they were treating it like somebody had a pneumonia and they were basically killing the patients. Now they're giving them drugs to kind of calm down their immune system. Your immune system is what's supposed to protect you from infection. But they're finding out in a COVID patient that your immune system is overreacting and it's making a bigger problem. So they're giving people drugs to kind of calm down their immune system, which doesn't really make sense from fighting an infection, but it's actually working better in treating those patients.
What's the medulla oblongata? What is that, if I'm saying it correctly?
So the medulla oblongata, very good, okay, is the part of your brain that looks at the level of the carbon dioxide and tells you whether you need to breathe deeply or not deeply. Okay, so
if someone gives you a knock in the head, is that a spot that will knock you right out?
No. So the medulla is really kind of right above. So we'll get to it soon, but if you look at the skull and you have the brain inside the skull, right? So you have your brain inside your skull. At the base of your skull, where you're resting on your neck, where your head is resting, your skull is resting on your spinal column. So your spinal cord comes up and connects into your brain at your medulla. So the easier way to say the medulla oblongata is your brain stem. So the bottom part of your brain, which is the most protected part of your brain, obviously, is the part that connects to your spinal cord, and that's the part that sends the signals for breathing, amongst a couple other things. Right now, we're only talking about breathing, but it also tells the blood vessels what diameter, how big or small they need to get, and stuff like that. Okay, so it says, what happens when acid comes up? Can it enter the trachea? So you're talking about stomach acid, called reflux, right? So yes, if you're lying flat, okay, you could have reflux come up your esophagus or your food pipe. You could have acid come up because your stomach has acid to digest food. And if it slides back and touches your trachea, your windpipe, you'll have a spasming, a shutting off of your air, and you'll feel like you cannot breathe. So if you have that, if you ever woke up at night and you felt like you couldn't get an ounce of air in, that's exactly what happened. And it's usually because you ate a big meal or a spicy meal and then went immediately to bed. And because you were lying flat, it was easier for the stuff to come up. Okay, so somebody wrote the number 12. I don't know what that means is. Can you explain the last thing again? How does constricting render the lungs larger? So when a muscle, okay, so here's the deal. Right now, my intercostals and my diaphragm are relaxed. Okay, so they're just at their normal size. When the brain tells us to breathe, the brain tells those muscles to go like this and to get tighter. So what they do is your diaphragm, let me just change the camera. Your diaphragm now, because it's getting tighter, pulls the diaphragm downward, and your intercostals, because they're getting tighter, pull your rib cage this way. So if your diaphragm's going down and your intercostals are going out this way, the size of your chest increases. And that means the pressure inside your chest decreases. And it decreases enough to let the pressure become less than out here in the room, and air flows back in. And remember that your lungs, because of that little bit of fluid, stick to your rib cage. So if your intercostals are pulling your ribs this way, they're pulling your lungs with it, and they're making the pressure inside your lungs less than the pressure in the room that you're in, and the air then flows in. Okay, and if I'm not explaining it, then obviously let me know. What's the regular color of the skin? Is that, I guess that what that means. So depends if you're Jewish or not Jewish. Jewish people tend to be very pale because they're inside all day long, unless they're doing like outdoor construction work. So the normal color of the body is pinkish, that you shouldn't look pale, you shouldn't look white, you should actually have some color. Like if you took a week and went to Miami and you got some sun, that's what you should look like.
I think he asked that question when you were showing the color of the veins. Would it get blue and red?
Okay, so blood vessels that have oxygen in them usually would be reddish colored, pinkish colors, and blood vessels that don't have oxygen in them would usually be bluish color.
Is that going to be physically red and blue, or just in the picture?
No, in real life, well, you can't see really too much blood vessels. I mean, you could see some very small surface blood vessels, when you're looking at somebody's skin, but you really can't see inside the blood vessels very well. So there's no way for us to look at somebody's blood vessels and get an idea of their oxygen level, but you can look at their mucous membranes of their lips and get an idea, but you always have to take into account their temperature, right? If they're cold, then you have no idea if their lips are blue because they're cold or their lips are blue because their oxygen level is low.
So the only way to see that is with a O2.
Yeah, O2 saturation, blood test, yes. Okay. Does it have, somebody wrote, does it have holes to feed the blood?
Yeah, you explained it already. Yeah.
Okay. Why is it called intercostals? Okay, good question. So inter means between, and costal is the Latin word for ribs. So they're the muscles between the ribs and across the ribs. So that's all that means. Okay. Are the ribs flexible? Great question. So you have 12 ribs on each side, right? The first 10 are pretty solid. They're connected from your spine and your back to your sternum and your front. So they're pretty solid. The bottom 2, so you have 4 ribs that are called floating ribs, which means that they're attached to your back and your spine, but in the front they're not. So they're flexible. They can move a little bit. I think what you're really asking is that when the muscles contract, are they actually stretching the ribs themselves? And the answer is yes, a little bit. You have a little bit of ability. Those ribs do have a little bit of ability to get bigger in size, or at least your chest cavity has the ability to get a little bigger in size when those, when you're trying to breathe in. Okay. What's the term collapsed lung? So the collapsed lung is called a pneumothorax. So pneumo means air and thorax means chest. And you should not have air in your chest. You should only have air in your lungs. And that's a little hard to understand the difference now. Your chest is the cavity that your lungs are in, right? So the air should be inside the sacs of your lungs, should not be escaping out of your lungs, stuck in your chest, right? Air should only be coming in and out of your trachea. It shouldn't be like leaking out of your lungs. So it has to be an intact system, with no holes in it. Okay, and then somebody wrote nose and filter. I'm not sure what, oh, he answering the questions. Nose filters, okay, cleans and warms, very good, okay. Please everyone mute unless you have something important to say. Sorry. In a polluted area, is it better to breathe through your nose? Yes, in a dusty area, okay, it is, but remember, there's all different types of pollution, so that, when God made us, the pollution that we breathe in today didn't exist. So your nose is not designed to like filter out chemicals. You know what I'm trying to say? Like these chemicals, that we've made through science were never around when we were designed. So it's good for filtering out dust, things floating in the air, and stuff like that. It's not good to filter out, chemicals and stuff like that. Obviously, it doesn't filter out, disease, because it actually lets your respiratory system is one of the main ways that disease enters into your body. And the reason why is that viruses and bacteria are so small that they are actually able to float through all the protection. And he mentioned it's always better to breathe through the nose. Yes. Is this why the veins are more visible in the skin? So the veins are more visible on the skin because the way the body positions blood vessels is that the ones that are most likely to make you bleed to death, if they were cut, are deeper in your body, so they're less likely to be cut. So arteries are deeper inside your body, so they're more protected, and capillaries are more towards the surface of your body, okay, because they're so small you can't really bleed to death from them. So everybody who's been cut so far, everybody who's had bleeding, okay, the bleeding that most of us have seen is capillary bleeding. If you had arterial bleeding, you are lucky to still be alive because it doesn't take long to bleed to death with an artery. And even if you cut a vein, okay, you could still bleed to death. So most of the bleeding that we've seen is capillary bleeding, okay? If you get a laceration, the less important blood oozes out. So when blood oozes, which means it doesn't come out real fast, it's typically a capillary, okay? Blood that flows is a vein, and blood that spurts with every contraction of the heart is an artery. What exactly is intercostal? Intercostal is just a term for between your ribs. So intercostal muscles are the muscles, that are between your ribs, okay, or over your ribs. Okay, so I think I went through all the typed questions. Does anybody have any other questions? Okay, so we hit about, I don't know, 10% of anatomy and physiology tonight. So we got a lot more to do. It will make much more sense if you can open the book and read it. I know some of you are, because some of you are calling me with good questions. Okay, so some of you are reading, some of you are depending on just listening to me, which is, I'm going to tell you, is not going to be enough. You got to reduce some reading. Okay, so see if you can get some reading in over Shabbos and reading it over the weekend.
That's why we did it in the weekend.
Right. Concentrate on anatomy and physiology for right now. And please, I'm serious. If you have questions, call me. Even if you just shoot me a text, like everybody's sending little messages now, just send me a text. Try to make use of some of the review material on Dropbox. Okay. And I know it's a lot. I know there's a lot of stuff, to learn in a short period of time, but we will get through it. Okay. And you could also reach out to David and Yankee, and like I said, they know that if they don't understand it or they have a question, that they'll reach out to me. Okay.
What is the schedule for next week? Is it going to be Tuesday, Wednesday?
Tuesday, Wednesday, right? Monday you're off. Okay. I don't think there's skills on Monday. So
Sunday.
What's that, skills on Sunday? Okay. So Monday is a free. Okay. Well, I don't know if it's free because you probably have to do some studying. I will finish up this quiz. I'm tired now, so I'm not going to do it tonight, but I'll finish it up tomorrow. And I'll send it out before Shabbos. And when you get a chance, you can start working on it.
You sent out the quiz already for yesterday's.
It's not going to be tonight's stuff. It'll be mostly, mostly yesterday's stuff. Maybe one or two little questions on, tonight's stuff, but nothing super hard because I want to be able to go over it once or twice more. Okay. And I think that's it. So I think what I'm going to start doing, if I remember, is maybe to start every class, we'll review the questions from the quiz before, just to make sure everybody understands them. Okay. So I'll try to start remembering to do that. Okay, any questions? Anything? Okay, so everybody have a great Shabbos. Try to get that reading in, and we'll see each other on next Tuesday night. Okay?
Thank you.
Thank you.
Everybody be well.
Good Shabbos.
Take care.
Google Doc for the skills.
Thanks, good Shabbos.